you for joining us today. We will be having our regular and emergency meeting for March 24th, 2020. And then later on, we'll have our special meeting, which is our 10:30 time certain. So with that, I will open our regular and emergency meeting, and I would like a roll call, please.
Supervisor Zaragoza?
He might be on mute. Right, go ahead.
Supervisor Bennett?
Here.
Great.
Supervisor Zaragoza, are you there?
I know he's at his office.
Supervisor Parks?
Yes, I'm here.
Supervisor Huber?
Here.
Supervisor Long?
Here. Thank you so much. And with that, let's start Pledge of Allegiance. Right hand over heart. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. That's a very nice way to start our meeting off. Gives us the right tone. With that, I will have our CEO, Mike Powers, go over our agenda review.
Thank you, Chair Long, board members. On the regular meeting agenda, item 5, public comment. A comment letter from Rebecca has been submitted. Item 9, CEO's office requests that this item be limited to receiving a verbal report on the status of eviction protections and receive direction from the board concerning an urgency ordinance temporarily suspending evictions in the unincorporated area. And one comment letter from Daniel Ukelson has been received. Item 10, CEO's office, adoption of a resolution authorizing pay for employees due to natural disaster COVID-19. A board letter and exhibits 1 and 2 have been submitted. On the special meeting agenda, item 1, CEO's office, authorization for the county executive officer to approve and execute contracts and amendments as necessary to purchase goods and or services related to the COVID-19 state and local emergency. The board letter has been submitted. And finally, on the emergency meeting agenda, there's one item, closed session, oversight of medical staff privileges, approval of medical staff and allied health professional membership and or clinical privileges for practitioners at VCMC, Santa Paula Hospital, ambulatory care, behavioral health clinics, and the inpatient psychiatric unit. And that's it. Thank you.
Thank you. Supervisors online, do you have any changes or modifications? Okay, and with
Madam Chair, may I?
County Council?
There is a requirement before we proceed with the emergency agenda.
Okay, and what is that?
There has to be a vote of the board. It could be, there's two options. One is a 4/5 vote that there is an emergency and the need to take immediate action arose after the agenda was published.
Okay.
Or there's an alternative one which only requires a majority vote. But if I would suggest a 4/5.
I have to give a hotkey that toggles the mic off.
Sorry, there's noise from a phone. Please go ahead.
Anyway, so if there's a motion that there's a need for an emergency item and the need for it arose after the agenda was published, and also that the item will be heard in closed session.
Okay.
If there's a 4/5 vote for that, then we go forward.
Okay. So supervisors, is that made clear? We need a motion.
I'll make that motion.
Thank you so much, Supervisor Bennett. Can I get a second?
Second.
Second by Supervisor Parks. Thank you. Any further discussion? All in favor, say aye. Aye.
Aye.
Aye. I heard 5 ayes, and that Supervisor Zaragoza has now joined us. And so with that.
Thank you. Good morning.
Good morning, sir.
Okay.
Hold on one second. We're going to redo the vote. I know that verbally we heard 5 yeses, and so the motion has been approved unanimously. Do we also need to make the vote for the agenda itself, or is that included in that motion?
That's included, and just the only other special requirement is we have to post minutes of the closed session have to be posted as soon as possible after the meeting, which is a little different than normal.
Thank you very
minutes of
much.
any action that was taken in closed session.
Okay, so I am glad we clarified that to make sure the public knows that our meeting notes will be come out quickly because of that modification. Thank you very much.
That's all. Thank you.
All right. Yes. All right, the next item is our public comments, and we have one. We'd like to read it into the, where is it? Do you have it? Oh, okay. Is Rosa gonna?
Hi, this is Rosa Gonzalez, Chief Deputy Clerk of the Board. I'll be reading real-time emails coming in to the Clerk of the Board email throughout the meeting. We will start off for public comment. We received an email from Lynn DeMott regarding the denial of further lease option or exclusivity extensions for Fisherman's Wharf area and parcels X3 and F-F1. Her email goes, greetings. While I expect the delays due to COVID-19, I know this item will come before you at some point and would like to express my concerns. Please terminate CIHPS lease option agreement due to failure to meet their required deliverables, such as obtaining an LCPA from Oxnard. I also ask for you not to extend their exclusivity for parcels X3 and F-F1. An open, transparent request for proposals for competitive development plans should be issued for all these areas. Also, the county should begin work on the harbor's 34-year-old public works plan that is in serious need of an update. Like my neighbors and friends, I would like to see Channel Islands Harbor revitalized. Thank you for your consideration. Regards, Lynn DeMont.
Thank you very much. And just to clarify, the public comments, we have asked people to email them into the clerk of the board email because we are closed, our building is closed. And so we are trying to make sure that we obtain everyone's public opinion, even though we're going through this troubled time right now. So thank you very much. Are there any other public comments? Okay, and seeing none? Yes.
I would note that people who do want to speak through email to go to clerkoftheboard@ventura.org.
Thank you very much. Appreciate the clarification. Okay, next item is our board comments. I will start with Supervisor Zaragoza. Okay, we'll come back to him. And Supervisor Bennett.
Yes, thank you. My board comments outside of the adjourn in memory, which will be a list that we will send over to the clerk's office, deals just with the seriousness of this virus that's out there. And we've been asking the public to do an awful lot. And right now, I want to address the work of all of us that work for county government, from the Board of Supervisors to Mike Powers and the top administrators, the middle managers, the people that are in the front lines. People have been working really hard, and I have, and my comments are not about what's happened, but about what we're getting ready to do. And we really all need to step our game up here and be A+ performers. The mission of county government, when it was created by the state, is to protect the health, welfare, and safety of the citizens of Ventura County. And I can't think of a crisis that involves all of us more than this. Did you say something, Supervisor Long?
We can actually see you on the screen, so it's very nice to see you. Hi.
All right, great. So so I can't think of anything that affects more of us. And we think back to when we've had those terrible fires, and we talk about or the terrible incident that we had, and we talk about deputy sheriffs running into the danger, firefighters running into the into the burning building. Well, now we're going to have doctors and nurses running into the hospital, running into the danger to deal with those patients. And the rest of us in county government have to play a very important supportive role for those heroes and heroines that are going to be doing that for us. And that is by doing everything we can to minimize this thing and flatten the curve. And so up to this point in time, we've had some time, but now before each one of us rests tonight, we need to make sure the areas that we're responsible for, we don't leave things undone. If we're responsible for vulnerable populations and skilled nursing facilities, we need to make sure we have the checklist of everything that facility needs to do, and that we make sure that facility knows what we're expecting them to do. If we have a facility that doesn't have the capability to do those things, maybe because it's a facility that only provides care to low-income Medicaid patients and it's a very low-resource facility, then we've got to figure out how we're going to help them with that. But every procedure, what do they do when they have somebody with a high fever? What do they do if that person tests positive? What if they don't have a way to quarantine them? What are the plans? We can't leave those questions still out there uncertain. And I just use that as an example. This happens with homeless populations. It happens with seniors that are in their homes by themselves, people in trailer parks, and then it also happens with all kinds of other things that people in county government are responsible for. But whatever it is that we have to be at our best game. And when this is over, I hope all of us can look back with real pride at saying, yes, we did our best. We didn't sleep on things. We were proactive. If we saw something that needed to get done, we got it done. So it doesn't feel very. It feels weird trying to give this kind of talk from a screen doing this, but it's the best we can do in this situation. But we have 8,000 employees that right now, everybody, the other 800,000 people in this county are really counting on each one of us to make that extra sacrifice and think about the good of the 800,000 and the good of the general public that we've pledged to serve when we took this job. So thank you very much, but those are my board comments. I appreciate it.
Thank you very much, Supervisor Bennett. We're going to go back to Supervisor Zaragoza. Hello, Supervisor Zaragoza.
Can you hear me? Can you hear me?
And we can see you as well. We're putting you on the screen right now.
Okay, well, thank you so much. I just want to share with the board, and staff, that I want to thank the individuals that are helping us out. I heard Steve Bennett speak, but I just want to share that our people continue to assist the public, and especially over in 9 Acres. I want to commend Mike and Mary Ann Rooney.
Can I interrupt you for a minute? Could you either mute your phone? You have 2 items on, and we're getting some back noise.
Can you hear me?
There we go. Thank you.
Can you hear me?
Yes.
Okay, I just wanted to share, go back to, that I want to thank the residents for helping each other out, especially over in 9 Acres, where Mike and Mary Ann Rooney had handed out right now approximately 1,200 lunches to the students out there in 9 Acres. Not only are they handing out lunches to the students, also to some of the seniors, and also additionally, we're also handing out, having the people sign up for the census, which has really worked out pretty good. Additionally, Madam Chair and Board of Supervisors, I want to commend Mike Powers, our CEO, because I heard him in the news this morning, in the radio, sharing with our residents exactly what we're doing here in the county with the hospitals, with the first responders, with what staff is doing. I'd just like to commend him for giving that information to the public this morning, and I think it's absolutely great that we continue to do that. So anyway, and also what I'd like to do And I know I have a lot more to share, but also I'd like to adjourn in memory of the two folks on this list, Mr. Luis Flores and Mr. Bill Shaw. And I want to thank you for the opportunity to share this morning. And thank all the residents and everybody that's helping us out with staying at home and the 6 foot apart and washing their hands and just following the protocol from the U.S. to the state, to the county, and to the cities. Thank you so much.
Thank you very much. Next up will be Supervisor Huber.
Thank you. I'll be very brief. I just want to say thanks to our county staff for their dedication and hard work protecting our Ventura County residents. Appreciate it very much. Keep up the good work.
Thank you very much, Supervisor Huber. Moving on to Supervisor Parks.
Good morning. I want to extend my appreciation to everyone that is working so hard at the county for our community. And there is something that everyone can do, everyone, and that's to stay at home, not only for their health, but the health of others, and importantly, to avoid a surge at the hospitals. And I also want to extend my appreciation to the good call out for supplies that are needed in our hospitals. For example, the Oak Park Unified School District found 1,000 N95 masks. Other school districts may have them too, left over from the Woolsey fire. So in a sense, we are prepared better because we had those supplies during the Woolsey fire. And I know particularly, and we'll hear from our healthcare professionals, we're looking at for hospital gowns and others, but if there are supplies out there, now is the time to get them to us. Also, want to encourage people in their staying at home to find creative options. There are, for example, community-supported agriculture, CSAs out there. They'll deliver produce to you. Some of the grocery stores will. Anything that we can do towards keeping people at home and everyone doing their part. Also want to extend our sympathy to people who are suffering greatly from this illness. I lost a good member of our extended family, and you realize how sudden this can be and how important it is that we all do what we can. And a lot of that has to do with staying home. Thank you.
Thank you very much, Supervisor Parks. I'm sorry for your loss. On to my comments as your... First of all, I just want to say how overwhelmingly just proud I am of our community and of our staff. We have been moving in the last 2 weeks at least at hyper speed, 24/7 to ensure the safety of our community. We have been really reaching out to everybody to help, to either volunteer your time, to donate supplies, to even making sure that you just stay home and do your part and wash your hands and take it for 20 seconds. Every little step that we are doing is helping us so that we can definitely flatten this curve so that our healthcare system can handle the load when it comes. And I wanted to really say thank you to everyone. Even though it might not feel like you're doing all that you can, I know sitting at home working and you think you need to be out, you need to be social, you need to be talking to people and making sure we're working and all this. And I understand that. And you have to remind yourself, at least I do, that by staying home, you are helping because you're reducing that spread. And I just want to make sure everyone is still, you can still be social. You just have to actually pick up a phone or go on Skype or do social media and get your social interaction that way. So I just really, I know sometimes people feel like it's a lockdown. You know, what am I doing? Just sitting in my house. But take this time to really know that you are helping people by reducing your socialization and staying that 6 feet of distance. I know we're going to hear that over and over, but I just can't reiterate it more about the importance of keeping your distance so that this doesn't spread. And I really want to thank our legislation, both on the state and federal, and even our elected officials in our cities and our school districts, all coming together for the greater good. I've been on so many calls from the state as to what does Ventura County need. From the federal side, what do we need? What declarations do we need? We have been really getting a great support, and they've been hearing us. So maybe they don't agree with us sometimes as to when we need things, but they're agreeing with us about hospital supplies, about insurance, making sure people are covered, about EDD, you know, there's so many different things. I could keep going on, but I just want to say thank you because I know everyone is really working hard so that we can end this in a really good place. And so I just want to make sure that everyone go to vcemergencies.com for all the latest information. We are all trying to update as much as we can without press conferences, so we keep our spatial distance. If you know, you can't see it, but in our board room today, we have spatial distance where employees cannot sit together and they are 6 feet apart. We are taking every step that we can and appreciate also the critical businesses that are still working. And I know that's hard. We have kids at home and so forth. So making sure that we're really keeping things moving so that when this is over, because we know it will be, we've gone through 3 other years of disasters. We know the disasters end. And so we just want to make sure that we can continue and move forward. So be safe, be healthy, and those are my comments. So thank you very much. Mr. Powers, our CEO comments.
Thank you, Chair Long, board members, and county team. So I'll save most of my comments for the update on our COVID response, but I would mention one item also that is going on at the same time, and that is on the census. Just to let you know that so far, Ventura County census response is significantly better than the U.S. and California average. So all that hard work and effort that the community and the county and the cities have put in, we're seeing the results of that. So thank you.
Thank you very much. Moving on
Madam-
to, yes,
Madam Chair,
Supervisor
can you hear me
Zaragoza?
now? Can you hear me now?
Yes.
Oh, good. I'm sorry we're having this.
Is it clear?
Is it clear?
Yes, it's much more clear. There is just a feedback. And to everyone, we provide you grace during this time. We are learning how to do this virtual meetings. So if you do hear feedback or whatever, we're working on it and we'll get it done as quickly as possible. So Supervisor Zaragoza, thank you for getting that figured out. Appreciate it.
Madam Chair, it's the computers, not us.
Yes, exactly. I would agree. Thank you. Okay, moving on to one of the hottest items of our meeting is our receive and file. It's a report on the COVID-19. And so without any more delays, we will start off.
Thank you, Chair Long, board members, county family, and community. Appreciate the opportunity to present to you today, give you a status report on all the efforts that are taking place on many, many fronts across our county, both our local governments and our community efforts. Would just start off with what many of your board members have already said, but this is a critical time. This is it right here. These next few weeks are going to make a huge difference in how our county fares in terms of our ability to prevent the spike, mitigate the spike, try to flatten that curve and reduce the number of cases, and frankly, just to say it, just to save lives in our community. That's what it's about. And each one of us can do something about it, which is good, because in so many disasters, people want to help, but they don't really know how to. They kind of feel helpless. But in this one, the good news is we know what each one of us can do by sheltering in place and practicing social distancing. That's really going to save lives, particularly of the most vulnerable members in our community, our seniors, people with multiple chronic conditions. the people we know and love in our community. So the good news is also that there's a lot of progress happening out there in the community. People are doing it. Businesses are making terrible sacrifices for the health of the community. Individual schools are closing. People are continuing to help in every way. Our frontline healthcare providers are out there every day taking risks to protect the health of our public and all of our hospitals and health centers and clinics, and then our first responders, fire and sheriff, everybody is out there. Those essential services are continuing to happen because we have to do that, but they're out there looking out for us, and so we have to look out for them as well. So all of this practicing of sheltering in place and social distancing is a big help for them. And then the call out to the community has already had such a huge impact. We knew it would because we've seen it in response to all these disasters we've had the last 3 or 4 years, but it is powerful. I think just about every 10 minutes I see, or our OES director, Patrick Maynard, sees another contribution from a school, from a business, from an individual, from the doctors getting creative about how they make masks and people sewing masks. It's just people are coming out of the woodworks, and that's what Ventura County is, right? We rally together, and so that's happening. But we do get just one chance to do that, and that's these next few weeks. And as I said before, when it comes to staying apart, we got to stick together. And that's what we're doing. We just need to kind of double down on it and do even more of it. So with that, we'd like to give you an update on the status of things and our efforts and get your feedback as well. So with that, I will turn it over to our Public Health Director, Rigo Vargas.
Again, Mr. Powers, staff, thank you for the opportunity to, again, just make some brief comments. And as you can see from the slide and the agenda for this presentation, it's definitely a team approach, a team effort, and it's been outstanding to work with our county family and leadership and stakeholders throughout the county on this response effort. My comments will be focused around the cases and testing. So as you know, we report, as of yesterday, we reported 35 cases, and unfortunately, tragically, it does include our first fatality. Our thoughts and prayers are with that family. It's very sad news. We expected, just like we expected our first case, we unfortunately expected that eventually, like so many counties, states, and nations, deaths would occur due to this public health tragedy. So our public health lab team continues to work very hard around the clock, and in fact, last night they did 4 test runs. At the end of the night, they gave me a report, and we out of the 66 tests that they conducted, unfortunately, 6 more positives. So as of today, we're at 41. We don't, obviously, because it was late last night, have the breakdown, but by this afternoon, we'll have the breakdown as we've been reporting it now by age and city. As we report those numbers, I think the public, the audience, all of you are aware that that information is on VC Emergency, and I'd like to call out a couple of the particular stats, and this is with regard to the 35 that have been publicly reported. So, as we know, this illness, this disease affects vulnerable populations, seniors, those with underlying health conditions, but it's really affecting everyone. As you can see, or if you refer to our numbers, about 43% of our positive cases so far are in the age group of 45 to 64. So yes, our elderly, those with comorbidities are at great risk, but it's spreading more with younger populations. So it can affect everybody, and it has been affecting everybody. And as we also know, it's really spread out throughout the cities, and the primary transmission mode will, moving forward, be community transmission. So we know it's obviously that it's in our county, and the numbers are increasing. I'd like to just thank everyone, the board members and Mr. Powers, our PAO, everyone that's doing in a concerted effort, spreading the same message. As you know, our public health officer's order is titled "Stay Well at Home," and so that's what we need to be asking the public, and they've been very cooperative on that. So I'd like to conclude with just thanking everyone for adhering to that order. The message is stay well and also help us stop the spread. Nevertheless, preparations are occurring for us in the likely event that we're going to have a surge in our medical system, and so more information clearly to follow me. So at this point, I'd like to turn it over to Dr. Levin, our public health officer, to speak a little bit more on the order. Thank you.
Thank you very much. Dr. Levin, good morning.
Good morning, Madam Chair, Supervisors, Mr. Powers. I have a number of comments that I could make. I think almost everything I wanted to say was said in the supervisor's comments and in Mr. Powers' comments. I will go over some things, and that is, I just want to start out by thanking Mr. Powers. A lot of people just say thank you and move on from there, but I just got to tell you that this has been a very stressful experience, I think, for a lot of us working in government. And usually that stress comes from the top. But no matter how stressed out I am, when I see Mr. Powers and I talk to him, it is like letting, for me, air out of my balloon. He says, whatever you need, whatever you've got to do, we've got to make this happen. It's your people, run with it. We've got to do this. And it's really great leadership that we have. We've got a wonderful new PIO. The supervisors have been great. They've been supportive. I could tell stories about every one. I'm just going to talk about one this time, and that's Supervisor Parks. She is an eagle. She is a hawk. Everybody that comes to her or goes to her office and talks about some business that, for instance, is ignoring our orders, she lets us know about, and we do something about it, and we close them down. These steps that we're taking, this order, is making a difference, and it will make a difference. In China, when this started to happen in the first weeks, every case of COVID-19 was given to 2.3 or 2.4 other people. Then they implemented a very rigid closing down of the original site, and within 2 weeks, they appreciated a decrease from 2.3 to 1 case that was transmitted from every other person who had the disease. That's a big difference, and it's a quick response. I'm not saying this thing's going to be over in 2 weeks. We're facing more than that, but it makes a difference what people do. So if people want to know what they can do, it's don't get infected. Take the steps that you can to not get infected. Anyone can, and if you do, it's not necessarily your fault. I could get infected next. I may well be. But we all need to try not to do that. Kids don't congregate. You can bring this home to parents and grandparents. We are doing, as a county, a great job overall. If you go out into those streets out there, drive those highways, you'll see the impact that people's responsibility has made. A few individuals are taking it lightly. I think their friends need to point out to them, their family needs to point out to them how important it is to take responsibility. A few businesses are not being responsible, I'm sad to report, and I think it's just a few. But a major grocery store chain has not done anything to keep people from going in there. There's no efforts to socially distance. There is no efforts to limit the number of people in that store. The same is true of a major drug company chain in our county. And yet, I go over to Trader Joe's, and I see what they're doing over there. If you get to Trader Joe's, first of all, if you're inside, there's only 30 or 40 people around when there'd normally be a couple hundred inside customers. In front, off to the left, there's a line of people waiting to get in. They're spaced every 6 feet. And then to the right, there is a greeter for the store with a line of carts behind him. As a person leaves, he lets someone else in. And if you look at the back of the carts, there is another Trader Joe's worker who is wiping them down with antiseptic. Trader Joe's is doing a wonderful job being responsible, and they've set an example for, I think, every store in our county. And then the other thing that these stores could do is also make some rules about hoarding. You go into some stores, and there are grocery carts that are piled 3 feet and 4 feet high. So that's another thing that we can do. And I'm going to leave it at that, leave my comments there.
Dr. Levin, could you just reiterate, because I know sometimes, like a parent, you could tell your children something and they won't listen to you, but you hear from a professional and they'll listen to you. Could you reiterate just, I know it was in our board comments, but could you state one more time what we should be doing to keep safe?
Again, the major thing you can do, the first thing you can do is take care of yourself. It's almost like you're on an airplane, and they tell you the counterintuitive thing, if there's a problem and oxygen falls down, put it on yourself and then do your kid. The same is true here. Take care of yourself. Not only are you not, or less likely anyways, to become a case, but you are setting an example for those around you. And then make sure those around you are taking care of themselves. If you're feeling ill, don't go to work or don't engage with other people. We're not supposed to be engaging with other people, but I'm talking about even in your household. Try not to engage with other people. If you are lucky enough to have your own place to sleep and your own bathroom that you can keep to yourself, do that. Wash your hands frequently. There's a terrible lack, and I'm hoping it is improved soon with hand solution to clean yourself with. So use soap and water and wash your hands, and keep social distancing when you go out. Keep 6 feet or more away from other people. Did I miss anything, Supervisor?
No, and just to state, exercise is important.
Exercise is very important, but don't use exercise as an excuse to congregate. We have parking lots, places that are filled with people. And even though the beach is a beautiful place and it's a good place to exercise, stay away from one another. Perhaps find a better place where you can be more isolated to do your exercise. And while we're at it, we've all but closed down, well, we've pretty much closed down all of our SNFs and extended care facilities. But people in those facilities, they need human contact. So do your best to stay in touch with your loved ones in those facilities.
Thank you very much. Mr. Powers?
Thank you, Dr. Levin. I did have a comment and a question. I understand from Mr. Vargas that, through your public health order, we're also asking the private labs to report the number of total tests, not just their positives, combined with our public health lab tests. And so as of yesterday, I think there were a total of 680 tests. So as you can see, the number of tests between public health and the private labs is growing, of course, with the 41 positives. But what I wanted to ask you, Dr. Levin, is we're seeing in some large cities like LA and New York, they're saying, well, don't bother testing anymore. But that's not what we're doing here, and if you could share your perspective on that.
We're still testing. I think it's a matter of how far you are into this pandemic in your county, locally. And I don't know how that's going to play out. Testing does do one thing for us, and it lets us follow that curve and helps us, and it reassures us that we are doing the right thing. I think it can also let us know, based on that curve, that we need to do an even better job. We're already trying to do a better and better job and tighten things up more and more. But it remains to be seen how we will approach testing, especially now that this rapid test is becoming available. It's 45 minutes till you get a result. So you can make an argument either way for less testing or more testing, like they did in China, and they found that helpful as well.
Thank you. And then also, I am hearing people get a little stir crazy and want to take a drive. And I believe we're stating to keep within our county. Could you reiterate something about that message?
I was thinking about that this morning, and there's nothing specific in the order about driving. I would look to our chief county counsel to see his interpretation on that. But I think if you are going stir crazy and wanted to get in your car and go for a ride, don't go anywhere to be with anybody. Just go for a ride, open the windows, get some fresh air, get away, move around. So I don't see anything wrong with that.
Thank you very much. I just think it's important. I know things seem like they're common sense, but sometimes we have to ask those questions just to make sure. And I do appreciate with the order, the critical businesses, we have that list to make sure that we're keeping the essential businesses intact. So I really do appreciate the order and giving the more detail to our community so we know what works and what doesn't. Supervisors, did you have any questions for Dr. Levin or Rigo Vargas?
Yes, I do. This is Steve Bennett.
Yes, Mr. Bennett, or Supervisor Bennett.
For Dr. Levin's comments about right now we're going to keep testing, but we're thinking about maybe not testing. From my perspective on the board in terms of setting policy, it would be a big deal in my mind to stop testing. I think that the public has a strong expectation that if there are adequate tests out there, that they be able to be tested. I think all the stuff I've read about in terms of South Korea, where they did extensive testing, it really helped them in a variety of ways. It gave them more information for decision making. It helped the public in terms of understanding where they are. So I would want us to have a real policy discussion if our professionals think they're coming to the point where they think we should not test, right? So that wouldn't be something that I would take lightly. So I just want to interject that here since I heard those comments about the possibility. This is the first I heard about the possibility of some places not testing.
Supervisor, I look to what other countries and other states and other parts of our state are doing, and I weigh it and I think about it when I see it. And to quote my kids when it comes to stopping testing, I'm not feeling it. Maybe I will down the line. When we get to the point, certainly, where this is as widespread as influenza can be, well, then I kind of feel like, yeah, we don't get that much out of testing anymore. But we're not there yet, and I hope we can keep it from arriving at that point.
Well, and that's like in LA County, right? We have the emergency ship coming in, Mercy. They're looking for opening up another hospital bed. They're at a different level than we are. Is that correct? Okay. I just when we watch the news a lot, there's a lot of information being shared, and I just want to make sure that everyone knows what's going on in Ventura County might be a little bit different as to the amount of numbers that we're receiving than LA County. And so we completely seeing what's going on there, we have to really urge people to stay home here to make sure that we don't get to that level, I think is what we're all looking for.
Madam Chair.
Yes, Supervisor Zaragoza.
Yeah, Madam Chair, I just want to thank Rigo, and I want to thank Dr. Levin, for the information that you're sharing. I think the information that you're sharing is in concert with the U.S. policy, what the governor is sharing, what the counties are sharing. In fact, I was just listening to our governor yesterday, and exactly what he's saying is extremely important for the community to understand. So I think that information that you're sharing, Rigo and Dr. Levin, is very important for the community. And I don't want to reiterate again, about washing your hands and about making sure that you keep your distance and make sure that you don't congregate 10 or more. And one of the comments that you mentioned is really important, and I was just sharing it with my staff as we're listening. My wife she's been at home for days and days and days, and she was sharing with me, can you take me out in the car to get some fresh air and so forth, away from people. So I think that information is very important, but I want to thank you for keeping us abreast of what's happening.
Thank you. Mr. Powers.
Thank you, Chair Long. Yes, Dr. Levin, and we've talked in recent days about hearing that the symptoms are changing in some patients. We've heard that from your very perceptive public health nurses who've observed that, as well as some local physician. Could you comment on that?
Thank you.
Thank you. The symptoms that everybody talks about that are accepted for this disease are fever, 90% of people, cough, like 70% of people, shortness of breath and feeling really tired, 30% of people. Rare to have a runny nose, maybe only 4% of people. But one of the things that our chief communicable diseases nurse, Hannah Edmondson, noticed and kept coming to me after our first cases were appearing in this county was, you know, our cases keep having muscle aches and joint pains. Some of them don't have cough at all. It's just, I don't understand what it is. And indeed, when one of the people in our county who is in healthcare got this disease himself, he let us know that indeed that's how it started with him, with muscle aches and joint pain and headaches. And so I think we all need to be aware of that observation, not proven, but I think it's a really insightful hint.
Thank you. Thank you very much, because I know that we have long lines at the testing centers. People are wanting to get tested, and I think it's really important that we understand what the symptoms are. So if you don't have the cough, but you have achy muscles, it could be a combination just like the flu and so forth, and that the symptoms to really make sure we stay away from people, right?
Yeah.
Okay. Thank you.
If I could speak, please?
Yes, Supervisor Bennett.
Yeah, it's talking about symptoms. Dr. Levin, I just heard on the British Broadcasting Corporation that they're finding a lot of their coronavirus patients are suffering from a lack of smell and taste, and that has become a very dominant symptom for them. I don't know whether that's going to apply to the strain that's running through the United States right now, but I thought I'd just pass that on to you. It was just a couple of hours ago on BBC.
Okay.
That's the first I've heard of that, and thank you, and it may prove to be an important heralding sign.
Thank you very much. And supervisors, anyone else have any other questions before we move on? In hearing none, Mr. Powers.
Thank you, Chair Long and board members. So next up, we'd like to hear from our Emergency Medical Services Administrator, Steve Carroll. And as Steve is coming down to the podium, just to let folks know, we know this is a primary concern for our community. And I can tell you, I sit in on these calls regularly, and I think people would feel very reassured at Steve's leadership and all the private hospitals and public hospitals really being thoughtful about their surge planning and practical and preparing now. And they have been preparing for some time. So with that, I'll turn it over to Steve.
Great. Thank you, Chair Long, members of the board, Mr. Powers. Good morning. I'm Steve Carroll, Emergency Medical Service Administrator. In our ongoing response to the COVID emergency, public health and EMS staff is continuing to collaborate with our countywide hospital, pre-hospital and healthcare providers. Our 911 dispatchers, firefighters, EMTs, paramedics, and law enforcement personnel are prepared to respond to the emergency and are implementing appropriate measures to protect their respective agency personnel as well as patients and the general public. Guidance for dispatch and EMS providers is based on CDC guidance and is constantly monitored and updated as needed. We're also routinely communicating with our hospital and first responder leaders to enhance our communication and coordination efforts. Ventura County has 8 acute care hospitals who are actively engaged in responding to the COVID emergency. Each of the hospitals have enacted their surge plans to address the current volume and anticipated increase in patients. Some of these efforts include reallocating resources and personnel, assessing the supply needs, deferring elective surgeries, relicensing old sections of the hospital or actually old hospitals, and using non-traditional hospital areas to receive patients such as conference rooms and non-normal patient care areas and tents. We're working with each of the hospitals to assess that increased capacity through the surge plans and also the equipment available with those planning efforts. And based on our preliminary review, it appears that we have the capacity to increase by a few hundred to probably several hundred beds within our hospitals, and we're working with the hospital surge plans and with each in the hospital to assess that capacity right now. We've also enacted electronic polling to the hospitals on a daily basis to assess their current status and their current bed availability, as well as their projected 24 and 72-hour capacities. Staffing, of course, is always a concern, and the hospitals are doing a lot and working hard to address those challenges internally. Unfortunately, we don't have a lot of options to ask for outside help for staffing because everybody's in the same boat. Right. Additionally, our healthcare coalition is working diligently and communicating with all of our healthcare partners, including the long-term care, skilled nursing facilities, dialysis, surgery, surgery centers, home health and hospice clinics, and others. We're actively working with those skilled nursing and long-term care facilities to ensure that they receive appropriate supplies and guidance from public health, as obviously this is one of our most vulnerable populations. We initiated a new daily poll with the skilled nursing facility. It was the first time we have acted and initiated a poll with that level of care, and that started last week, checking for their bed availability, census, the ventilator and isolation bed capacity. And then also assessing for their equipment and staffing challenges. This last weekend, Dr. Levin, on very short notice, acted to conduct a conference call with our long-term care skilled nursing managers. And we had nearly 100%, I think 100% of participation from all of those skilled nursing facilities, where he wanted to emphasize the importance of implementing strict measures to protect these patients and also to be available to answer questions for them. Lastly, my amazing EMS staff, who has been working now for well over a month, along with the phenomenal team at the Emergency Operations Center, working tirelessly to ensure that our healthcare providers have access to adequate personal protective equipment. They're working with our system stakeholders and our regional, state, and federal partners to request needed personal protective equipment. And the EOC staff is also working with a variety of vendors and non-standard sources to find additional resources. There are some shortages already. We have a shortage of the swabs, which is needed for the testing, and also isolation gowns. Our healthcare partners have implemented conservation efforts to make sure that the PPE is used when appropriately and to try to extend our capacity within the current supply. We do anticipate more challenges in the coming weeks, and we're reviewing options for seeking additional protective equipment. Obviously, our healthcare providers and our first responders are our front line in this ongoing battle, and maintaining the health and a safe and healthy workforce is a top priority for us. So I'm welcoming any comments.
Thank you very much. The supply of swabs, it was noted in the New York Times article that came out last night and also today. Thank you to Dr. Flossie and our Healthcare Foundation and Ashley for combining this to make sure that people understand what's going in Ventura County nationally. How do we say we're run out, how do we get more? I know the gates have been opened, so if you could explain that.
So we have a request into the state, which is our normal process for requesting disaster supplies. And unfortunately right now they don't have any. They have told us that they're anticipating having some supplies, additional supplies, as the vendor chains are ramped up to try to address this need nationally and worldwide. So I don't have a good answer for you other than they're looking everywhere they can. They're even looking at different types of swabs to see if something else that's an option for another type of test can be used for this.
And I've heard about a saline and to get that information. And then also we have, what is the email that if companies are listening right now, no matter where they are, and they have gowns or they have masks, whatever, where is it that they're going to, who do they need to contact?
Orders.
And I know you have the...
Orders. So it's oes.orders@ventura.org.
Okay.
So oes.orders@ventura.org.
Okay, and I just urge people, there is a vcemergencies.com/donate, gives you all the information as to what supplies our purchasing needs to get. The other question you stated on hospital beds, and we had that conversation about maybe there's 1,300 hospital beds that need to be done. With all the modeling that's being talked about, where do you think our need is going to be for hospital beds? Because you stated that we're looking at different options.
Right. I've heard a variety of models, so I don't have really a good one. I've heard that we possibly need 50% more of our capacity, but I also have heard that we may need 100% more.
Okay.
You know, the fortunate part is that likely all of the patients that will be experiencing symptoms to the point to where they need hospitalization will likely not have it at the same time. So hopefully the ones that are better can be moved out and home, and then as more people are coming in. So ideally we'll have a slower surge and not the spike.
Thank you, and I think that's important for people to understand that we are looking at the models. It's not just one number, but it will fluctuate, and so we're looking at the needs on that. And then also there was an article yesterday for visitors at hospitals. Are you having that kind of conversation with your different hospital teams? What's the strategy?
I know it has come up. I believe that most of them, I don't know for sure, but I think Dr. Fankhauser can probably speak to the local.
Yeah, you can.
But I know from a personal level, one of my family members was at one of our local hospitals, unfortunately, last week, and my wife was not allowed to go in. So she got to sit in the car in the parking lot.
Right.
So I think it's appropriate, and and it's something that we have to be able to to limit the spread.
Right, and that's with the nursing homes and so forth as well, is that they're limiting visitors to all hospitals and to the nursing homes.
Absolutely.
Not because we don't want visitors, but it's to protect everybody that's in the hospital.
Right.
And also the people that want to come in.
Yeah, and that did come up on our long-term care call this weekend, and all of the skilled nursing facilities are well aware of that.
Great, wonderful. Mr. Powers, did you have anything?
Yeah, I was just going to say too, I know that Steve and the hospitals are watching very closely the number of ventilators they have, so they can check that capacity, but they also check on a daily basis the number of patients each hospital has on ventilators, so they can get a real-time sense of the capacity that they have.
The system has detected that a minimum number of lines are connected to this conference. Do you want to continue your meeting? Press 1 to confirm. If there is no...
Someone hit 1. We want to continue this meeting.
So yeah, and the ventilators are on our daily poll also. So we're looking at that on a daily basis, how many are in use and what's the availability. And I know all of our hospitals, through our conference calls that we're having with them, are seeking alternatives and additional supply of ventilators.
Thank you. Supervisors, does anyone have any questions for Mr. Carroll?
Yes, I have a question.
Supervisor Bennett.
Thank you. Mr. Carroll, appreciate the efforts with the skilled facilities. I know that we have a wide definition of sort of skilled facilities. We have people out there taking care of elderly people in homes with, like six elderly patients where they've converted a home over. We've got facilities that just take Medi-Cal patients. We have, high income facilities. Do we have a sense that across the board, all of the facilities with these congregations of vulnerable elderly patients, do they all have a no visitor policy at this point in time?
So I think that would be the expectation based on Dr. Levin's direction. We are also reaching out to that smaller group. This weekend we reached out to the skilled nursing facility, which are going to be our larger facilities. The smaller 6-bed and even some of the other residential care, we're reaching out to those folks also. They had a call yesterday, and we're also communicating with them on a routine basis. And Janelle, our Healthcare Coalition founder, has been doing an amazing job in communicating with those folks, as well as to our state licensing folks, to make sure that everything is being done to prepare for these facilities. So we'll be reaching out to those other facilities again further this week.
Well, I'm most concerned that it's those other facilities where we're going to have problems. They don't have as many resources. They don't have as much staff to stay on top of what are the latest mandates. So it's that other group. And I know as of yesterday, there were some of those that had not been communicated with and were still sort of on their own, floundering, trying to figure out what to do. So I want to emphasize that I hope we can really get to all of those facilities quickly this week. Once this gets into one of those skilled facilities, it becomes a real problem for us, in that situation. So thank you, and pass on my thanks to your staff. I know this, they're working really hard in terms of trying to manage these vulnerable populations.
Thank you.
Madam Chair.
Yes, Supervisor Zaragoza.
Yeah, Steve, thank you for the update. The question I have is, my understanding is that in Los Angeles, we're getting the Mercy Red Cross Floating Hospital. And the question I have, I'm sure they're bringing that in to help relieve the bed capacity. The question is that going to affect Ventura County at all by getting additional beds, for us if we ever need them?
So I've not heard specifically that they're offering those 1,000 beds to us. But being the way that the system works, we all work together. We have a regional coordination system, and then we go to the state coordination system. So if we exceed our capacity and we need additional, we would be reaching outside to find additional resources. So it is not completely impossible to think that some of our patients could end up there.
So we follow state protocol then, is that what it is, Steve?
Correct.
State protocol.
Correct.
Okay. Thank you for the update, and thank your staff too. I know you guys are working 24/7. Thank you so much.
Thank you.
All right, no other questions. Thank you very much,
Thank you,
Mr. Carroll, and we'll move on to the next one. Mr. Powers.
Thank you. Next up, I'd like to hear from Dr. Fankhauser, report on our VCMC hospitals, as well as we'll hear also from our clinic system, Dr. Terry Cho. Thank you.
Thank you, Chairwoman Long, supervisors, and Mr. Powers. I'll talk a little bit about the hospitals and share a couple of images, and then we'll introduce Dr. Cho, who's my ambulatory care counterpart, and then the two of us can field any questions you might have. As I mentioned at our last meeting, we have a tremendous amount of energy going into surge planning. I'd like to start by saying that a great deal of that energy is going into keeping our other patients safe. I think at a time like this, everyone hears about our plans for COVID-19, but we recognize there's still children getting appendicitis, and there's still trauma occurring. We have pregnant ladies delivering babies in our hospital every day, and the routine things. We're keeping away elective procedures, elective surgeries, elective tests, but as you know, all of us are at risk for needing an acute care hospital at any one time. And we have a large group of people working very hard to keep those people safe in the context of the COVID-19 outbreak. With regard to visitors, that's one of those steps. And as you know, we began restricting visitors last week, with the exception of children who need their parents, and of laboring and delivering and newborn care where moms and partners, and in the case of a trained doula coach, that individual is also allowed in the hospital, and then of course end-of-life care. But we do see it as a way to keep our patients safe, to restrict the visitor flow in and out of the hospital. We have a tremendous amount of communication going on, and you'll hear a little bit later about the community communication, but a lot of internal communication as well. We have 7:30 incident command meetings, which our HCA director, Mr. Foley, and our deputy director, Barry Zimmerman, attend with us, and that's really a time where the people who are in the trenches doing this face-to-face patient care work can relay information and challenges to the leadership team, and we can work together to solve those. In addition to those morning meetings, which are happening 7 days a week, we also have a morning and an afternoon huddle call with the nurses. Dr. Flossie has initiated a noontime huddle call on Monday, Wednesdays, and Fridays. and we'll be having a all-staff town hall this afternoon. All of that done through video without any large gathering of people. In addition to that, we have several focus groups working on specific issues related to surge planning, bringing together subject matter experts and stakeholders in those groups to make sure, even though right now, as of today, the number of cases in our hospitals in Ventura County has been very small, I think we realize that it's just a matter of time. So the planning needs to go on right now. We are, as Steve mentioned, planning for increased need for equipment, increased need for ventilators, increased need for oxygen supplies. We have workforce surge plans that relate to reassignment of individuals, and I think you'll get more detail of that later. But in addition, looking at our utility players in the healthcare agency, people who may be currently in a clinic or an administrative position who also have skills in the hospital setting, and preparing to relocate those individuals when the demand gets higher. And then finally, I think we all recognize, to protect each other, that PPE, our personal protective equipment, is going to be critical. And I think globally, and particularly in the United States, we're running short, and we're looking for ways to conserve that. We put in measures like restricting the number of residents in an operating room or in a trauma. We've put in restrictions with regard to the number of people who can go in and out of a patient's room. We've tried to batch activities so that people aren't using PPEs. And in addition, I just thought I'd share with you some of the novel ways that our staff and our community are working to try to expand our PPE supply. There are a lot of things that we do that are non-COVID related, that we can use other types of PPE in place of the PPE that needs to be preserved for these very, very high-risk interactions. So if you could,
you have
do I have the control
PowerPoint
here? You'll have to tell me which of these buttons.
There you go.
Thank you. So I just wanted to share this because to me this is a reflection of the innovation of our staff, as well as this partnership with the community, which really is honestly incredibly heartening to the people who are on the front lines risking their lives every day. This first image is of our Director of Nursing, Dr. Michelle Sayer, and this face shield that she has, as you can see, is ideal because it covers glasses. It doesn't steam up. It gives coverage all the way down to the chest. And people were looking for these. We're running low. We basically got our last shipment from the OES, and we knew that we weren't going to have enough. So a group of community members, including a large group of high school kids, put together a plan to print these headgear on a 3D printer. So it puts out a plastic head support that is secured to the head with a rubber band. And then on that plastic, there are 4 pegs. And on those pegs, a piece of laminating sheet is placed. And this is an inexpensive and very protective way for us to create face shields. I think they're in the process of creating 250 of these for us this week. The next thing is really an image of a team that the director of our healthcare foundation, Amy Towner, has gathered to begin sewing. A lot of the people who are using masks, I think as Steve mentioned, are people who are just coming in and out of the hospital, not really folks who need the high quality filtered protective masks, and yet, you know, these are good to keep people from touching their face. And I think there's a lot of people who feel comfortable in a mask in this setting. We have a large team producing cloth masks for those types of situations in which someone doesn't need the high grade hospital filtration masks. And then finally, this is our trauma team on the right, Dr. Romero and the trauma team have decided to use alternative PPE in the trauma setting, and this is just a corner of the whole team. If you look at the larger picture, there's 7 people dressed in the plastic that you can purchase from a hardware store with, as you can see, the umbrella bag sleeves, which keep full coverage, and that is one way for us to extend our PP use as well, and that was just implemented this week. Interestingly, the trauma team was, that UCLA reached out to our trauma team, and I think that this practice is going to spread.
Dr.
Supervisor
Dr.
Bennett.
Fankhauser? Dr. Fankhauser?
Yes?
This is Steve Bennett. I've had a number of citizens wanting to volunteer to do this, to sew, to make this alternative gear, etc. Could you tell me who should we direct citizens to? I think when this gets out, we're going to have a lot of people that would be interested in helping.
Donate.
Who is it? Who should we direct them to if they're interested in helping with this?
Thank you, Supervisor Bennett. I think what your point is well taken. There's a tremendous number of people in the community who want to help. From the hospital standpoint, it's really critical that we have a controlled way of managing this, because some of these online patterns are appropriate and some are not, and it's important for us to have a sense of who's doing it and how they're doing it. And so certainly coordinating those efforts is critical. And Amy Towner with our Ventura County Healthcare Foundation has been the one who's coordinating those. And someone could go online, her contact information is online. That would also give them a chance to look at the Ventura County Healthcare Foundation website, which I think is also a tremendous support, source for those who want to help our system.
It's also, Supervisor Bennett, if you want to copy and paste under vcemergency.com/donate, has the information for the Healthcare Foundation with Amy's email. And she's coordinating with everybody on the pattern, on the material, and on sewing and so forth too, because it's 100% cotton and there's certain specifics. So I agree that that's a good place to send people.
Thank you.
And with that, I'd like to introduce Dr. Terry Cho.
Could I ask
Supervisor
a question
Parks?
too?
Mm-hmm.
Thank you. As I connect with others that I know in different healthcare systems, some have a real need for the masks. Some, like ours, have like a real need for the swabs and the gowns. Is there a way to do some trading?
The hotline. Mr.
Answer that.
You want to
Sure,
answer
yeah,
that?
absolutely. So Supervisor Parks, if you could just let me know who has what. We do have an inventory. We are also trying to reallocate resources as we have them and as the need arises in various sites. So absolutely, we would love to understand what supplies that you are aware of and add that to our inventory so that we can get those out to whomever needs it at the clinics.
And more than just me, I'm just thinking about a system in place where hospitals can work together to, spread the wealth that they have and to make up the needs for those that are lacking.
Thank you, Supervisor Parks. We're going to have Steve Carroll, EMS Administrator, come down and respond to that.
Supervisor Parks, thank you for that question. We work again through all of our systems. Locally, we have one clearinghouse for all of our healthcare partners, medical, personal protective equipment needs. So we don't have, all the hospitals are doing their own, they're making sure that they're testing, they're checking their supply, but we have a countywide system of supplies that is going out on a daily basis. We have supply orders coming in, and supply is being picked up and delivered throughout the county right now. When we don't have the ability to meet a certain need, we do reach out to our partners. So we reach out to our neighboring counties, and then as happened yesterday, we reached out to the business community and to the public to see if there's any additional resources that we can get in. So that's all being coordinated through the logistics section at the County Emergency Operations Center. So we're actually meeting the needs for not only the county hospitals and our other 6 other hospitals in the county, but all of our healthcare partners that are responding to this. The additional thought is that all of that needs to be coordinated through through the sheriff's EOC so that we don't have people duplicating efforts. We want to make sure that we're coordinating this and getting the supplies to wherever they're most needed. And we have a process in place at the Emergency Operations Center for that.
And then for the smaller offices, like for example, we had a doctor's office that called our office and needed N95 masks. We had them from the Thomas Fire, so we dropped them off. But we also referred them to the healthcare bar on our VC emergency, which states where the 800 number is to call in for questions for smaller facilities. Is that where we should be sending them?
So all of our healthcare partners can send their requests in, and many are, because they're processing a slew of these requests on a daily basis. They can send those requests into that oes.orders@ventura.org. Right now, we're able to meet most needs. If we have the supplies, we have a allocation process that is determined on what we can give out to certain disciplines based on their acuity level and based on their size. I'm not going to give 10,000 masks to a 2-bed long-term care facility. We were trying to figure out how to navigate through that and make sure that our most acute facilities are going to have the top priority, and then we're absolutely supplying these other facilities and these doctors' offices. My office is where the smaller orders are being filled. They come to my office. My hallway is completely filled with boxes of orders that are processed, waiting for them to come and pick it up. So it's in process right now. Just they need to go through oes.orders@ventura.org. Again, I have to stress that's where we're the clearinghouse for all these orders while we have supplies. At some point, as supplies continue to dwindle, we have to continue to prioritize. We expect those other facilities, the doctor's offices, the clinics, to also use the personal protective equipment conservation efforts and use the PPE wisely and don't waste it. Some of this stuff is not a one patient product, especially for asymptomatic patients. We have to be smart and we have to conserve our precious equipment.
Thank you. Any other questions, supervisors? Okay, Mrs. Cho, Dr. Cho.
Good morning, supervisors, Chair Long, CEO, Mr. Powers. I'm here to give you an update on our COVID-19 response in our ambulatory care clinics. The first thing I would like to start with is that our clinics are modifying our business, but still here for all of our patients. So even though we are screening all patients at the door and we are making sure that we don't have people who are sick in the clinics, we're still open for those folks who really need medical care. So our focus at the clinics is really to provide services for anybody who has an urgent need. So if they have an infection or if they feel like there's something that they need to take care of, we are here for them and we are open. We also have visits for prenatal care as well as child checks, but we do have some modified schedules so that we get people in but have fewer contact appointments. So for kids, we really are pushing to get all the baby vaccines in by age 1 and not really delay vaccines or spread them out, because I think the increased exposure is probably not worth the risk. We are offering phone visits for our patients as well as a telehealth option that we are hoping to launch by tomorrow or Thursday. And I just want to thank Patrick Maynard and his team at OES for helping us with that. That will allow the physician and provider to be able to see their patient on a video screen. It allows also a nurse or a dietitian to join in that conversation as well as if we were in the exam room at the office. So I just wanted to let our patients know that we'll have that up and running. I don't want them to feel like we're not here for them, and I want to make sure that they do feel connected. The next piece is that we are continuing with our drive-throughs, but have recognized that 3 of our sites are especially busy. That's the one at AFMC in Ventura, Las Islas in Oxnard, and Simi Valley's Sierra Vista Clinic. We'd like to focus our efforts on those 3 clinics. Our staffing and resources, we'd like to direct to those 3. Now, that's not to say that the other clinics cannot test for COVID necessarily or do a drive-through or car evaluation. But again, those are the 3 locations where we have at least 50 to 100 calls on the phone per day. We are seeing about 50 to 100 cars in the lines there and testing about 20 to 40, sometimes even 50 per day at those sites. So we'd like to really focus on those 3 locations and get all of our both staffing resources, our supplies, PPE, et cetera, to those places so that we can really address the needs. We've designed a way to also address our healthcare workers who might become ill or concerned about COVID exposure. Those folks will be tested at the Ventura site. And for our first responders, law enforcement, EMS, and firefighters, we'll have those folks tested at the Las Islas location.
Okay. And where do people go to find out where the testing facilities are? Is there a location online?
Yes. So those. So if you have any questions, please feel free to look at vcemergency.com, as well as to call into the line and figure out where you'd like to go. Again, we encourage folks to go back to their primary care providers. All of the clinic systems do have a process by which they're going to offer testing for those who meet criteria. And for those who really have nowhere else to go, we will take them in our drive-thrus, but they would again have to meet criteria to be tested, as we've discussed previously.
Thank you.
Yeah,
that's perfect.
Any questions?
Supervisors, do you have any questions?
Madam Chair?
Yes, Supervisor Zaragoza.
Yeah, the question I have is, and I want to thank Dr. Cho for her presentation. The question I have is, when the call in on the video screen, what are we going to do with individuals that don't have a computer, or is there a phone that they use other than the video screen?
Yes, thank you for that question, Supervisor Zaragoza. We absolutely have the phone option. So for those who don't have a smartphone type of phone, we will definitely be available for phone calls. And so we will ask for patient's preference and what they have capacity to do. The platform we did choose, I want to point out, is very, very simple. We chose it intentionally because it doesn't require downloading an app. It literally is a link to your phone. So if you do have sort of a smartphone type of phone, you would just click on that link and be automatically connected into your doctor. So it's relatively simple, but again, if a patient doesn't have a phone that has, a screen type of thing, then we would offer a phone call.
Thank you. And by the way, too, just for information on Las Islas, you probably have quite a few individuals there, because it's all over the Los Angeles area television stations too, for information. They showed Oxnard and Simi Valley as a drive-through for the virus check, from Ventura County.
Yes, I agree. I do think there are many from LA.
Yeah, thank you.
Mm-hmm.
Supervisor Parks, did you have a question? Or was there any other supervisor that had any questions? In hearing none, right?
Thank you.
Thank you so much for everything. And please let all the staff know as well that we are so gracious for all the work that they are doing and to protect, and also the innovation. Amazing that we can use 3D printers and sewing. I know one of my staff members is sewing right now. Everyone is coming together. So I really appreciate it. I know the urgency is there, and I hope that people will continue to be give us grace and help us as much as we can. Mr. Powers.
Madam Chair, Zaragoza, can I share something on the 3D printers?
Yes,
I want
sir.
to thank our youth for helping out. I think it's important that we involve our youth in helping us and with different options. And I think that the doctor mentioned that it was our youth that came out with a 3D printer device to help, with the materials. But I want to thank you for that.
Thank you very much. Mr. Powers. Supervisor Parks.
I just wanted to piggyback on what you were saying, Chair Long, about the innovations, and seeing that, for example, I passed on to Dr. Frankhauser, a company that makes smart thermometers, and that they can, if you've got fever, it actually sends a message that can then be put on a map, so you can see hot spots, if you will, geographically. One of the thoughts now are that people who have already had COVID-19 have developed immunities. Are we doing, or is the medical establishment doing anything towards kind of identifying those people that are kind of, golden now in the system?
Dr. Cho?
So thank you for the question, Supervisor Parks. So IgG testing, or what is immunity testing to see if you've been exposed and already mounted an immune response, is something that is in the research realm at the moment. It's not widely available for us to order that on patients today, but I do think as we go into the future, that is an option. I just want to be clear that we don't have the ability to do that now. It's the idea of it is that many of us will be exposed and will be relatively mildly symptomatic and not even know that we had it, and eventually we will be able to test through immunity testing whether we've mounted the appropriate immune response and therefore are somewhat protected from getting COVID. But again, that's not a commercially available modality at this moment.
Yeah, so thank you, Dr. Cho, and thank you so much, Supervisor Parks, for the question. There's actually a pretty exciting effort underway, led by Vanessa Bechtel from the Ventura County Community Foundation, along with Assemblymember Irwin and Matter Labs, the Wint brothers, and a whole group of generous folks, and Dr. Levin and Dr. Fankhauser are actually consulting on it as well. So they think from the public health and the healthcare standpoint, they see great value in this, and the team is actually working to get access to a good number of those tests, and maybe as many as 20,000 in the short order and more. And my understanding is once you can identify those people, then you can see the people that don't have the immunities and focus and prioritize our safety efforts on those people. So yeah, things are in the works, yeah, definitely.
And also the innovation, thank you very much for telling us what you need, because it's been quite heartful to know that companies are hearing us and saying, look, I will switch all my machines to make hand sanitizer. I will switch all my machines from sewing to now make masks. I will switch all my things to do this. As soon as we tell them what we need, they've been very reactive, and that's nationwide. So I just appreciate it. The transparency and the communication between others are really, we're stepping it up, and I just appreciate it. Who would have thought umbrella bags would be the new thing, or plastic to wear, but they do the job. And that's really what we need to do right now, is keep our community safe. So thank you. Mr. Powers.
Yes, I wanted to thank Dr. Cho for her leadership too in ramping up the testing capacity in our system. And as she said, private practices are doing the same. But I also wanted to mention our public health lab. As you know, we were one of the first 11 counties in the state to be certified to do this test. And I think that really helped with early diagnosis and treatment and focus. They were able to turn around the test sometimes in 4 to 6 hours. So they've also been working hard, Rigo and Denise and the lab team. Right now, they've been averaging 44 to 66 tests a day. They started getting help from Santa Barbara County Public Health, so now they can do 100 a day. Mm-hmm. And next week they had ordered, and with good forethought, additional equipment. So by sometime late next week, they could do as many as I understand it, 200 a day. So collectively, there's a lot of great collective effort between public health and the hospitals in our county to really ramp up the testing capacity.
Right, and the private. Mm-hmm. So next up.
Yes, next up, we have a report from our Sheriff's Office of Emergency Services, and I'd like to invite Sheriff Bill Ayub down to give a report and just say what a great partner he has been to this whole effort. So thank you, Sheriff.
Well, thank you. Good morning, Chair Long, members of the board, Mr. Powers, county staff. For the record, Bill Ayub, County Sheriff. And I would like to give you a quick update on what's going on at the Sheriff's Office. We have all of our deputies out in the community still. There's been no reduction in services. In fact, if you are out and about, you'll see more deputy sheriffs because we have some that have been retasked from things like being school resource officers, doing traffic enforcement. We have very little traffic out there now, so not a great need for traffic enforcement, but a lot of deputies out in our community policing, hopefully making the community feel safer and available to respond for calls for services needed. In relation to the stay-at-home orders that we've seen, we've broken out reporting in 12-hour increments, and when the orders first came out, we saw almost 40 calls related to the stay-at-home orders in the first 12 hours. That has tapered down to 1 call in the last 12-hour period. We've seen a lot of voluntary compliance, a lot of people trying to do the right thing, but a general lack of understanding, which has grown less and less as time's gone on. So we are seeing people that want to comply, that are now understanding what they need to do, and we're trying to get that message out as broadly as we can. You probably heard the wireless emergency alert that went out yesterday afternoon. Just another method of us trying to get that word out to the public so that they can do the right thing and comply with the orders. We've been working really closely with our jail system, trying to keep the virus out of there. That's always a concern in a confined population like our jails. And we've begun a couple weeks ago screening people outside the jail system for signs of the virus. We have methods in place to put people with symptoms in respiratory isolation or to seek medical help if that's needed. But so far, things are going well in that regard. Our inmate population is actually fairly low right now. So if we do have an outbreak, we have the ability to address it through isolation measures in our facilities. We do not have an overcrowding problem. On the same note, we are not releasing inmates into the community prematurely. That's being done in some jail systems where there's concerns about overcrowding, concerns about the ability to isolate in the event that there's an illness that comes into the jail system. We do not have that concern locally. It's certainly something that we can consider as an option should things grow worse, but that's not something we're doing currently. We have been working really closely with the courts to try and keep the wheels of justice in motion. It's a challenge because of the confined spaces there, juries, and the close quarters that the courtrooms present. We've working with county IT as well as the public defender and the district attorney and the courts. We've stood up a video conferencing system so that we'll be able to have arraignments and some other court proceedings take place without that close-in contact that the courtrooms present. So we're excited about that as well. Let's see. Our Office of Emergency Services has been really key, as they always are, in responding to emergencies. And this event presents different but similar challenges to them. And I'd like to invite up our OES manager, Patrick Maynard, to tell you a little bit more about what they've got going on and how they're helping the community during this time.
Could I ask you a question before we move on to
Of course.
Patrick? Thank you so much for addressing the release of the inmates. I know in LA County they had done 600, so forth. So I appreciate you educating us on that because I know our community is concerned. One thing I heard was about ticketing. A friend of mine calls me and says, hey, our kids were out and this kid got a ticket for social distancing. And I didn't know if this was a usual thing or not, but can people get tickets for not social distancing and socializing out in the outside area where maybe they shouldn't be?
Hypothetically, there is an enforcement element to the public health orders. I'm not aware of any enforcement action that's been taken. I work closely with the different chiefs in the county, all the law enforcement leaders in our approach to how we will respond to violations of the public health order. And our approach is one of education versus enforcement. Okay. We consider enforcement really a last resort. Most people, once it's explained to them and they have an understanding of what the rules require, they just comply.
Well, and thank you. I appreciate that because maybe there was other incidences where that actually they received a ticket. You don't always hear all the story, but I at least wanted to make sure we talked about it. And then the other question was about martial law. When we are hearing that the National Guards are being opened, and could you explain to our public when would we put in place martial law and so forth? Because I don't believe we're there, but I think that's something we should at least talk about.
Sure. Yeah, we've heard rumors about the local National Guard across the country being activated to respond to the pandemic. This is not in a security role or an enforcement role. It's in a logistical support role. They're handling food pantries, delivery of materials, and basic labor tasks that a cohesive, coordinated group of people can accomplish. That's the purpose of their activation. Martial law is something that our civic leaders certainly could call for at some point in time. I don't see it happening, particularly in communities like ours, where we have terrific response to the public orders that people generally want to comply. I think that would be an extreme situation where people just refuse to comply and are unruly.
Good. So it's making sure everyone is complying. That's a
Madam
really
Chair.
important part. Supervisor Zaragoza?
Sure, thank you so much for the update. I just wanted to ask you, I've heard, in fact, I had a couple of individuals and constituents that called me last night, and I'm not sure if it's happening for sure, but they mentioned to me that apparently Oxnard is setting up a curfew. Do you know anything about that?
I'm sorry, did you say a barricade?
A curfew.
Oh, a curfew. I had not heard that there was a curfew that was being considered in any of our communities. Certainly a prophylactic measure the community leadership could take, but I'm not aware of that, sir.
Thank you.
Yeah, they mentioned to me that was at 8 o'clock curfew, and I've just contacted one of the council members, and they're going to get back to me on that, but that would be really extreme martial law, if you want to call it that, But thank you anyway for your update.
Mr. Powers?
Thank you, Chair Long. Yes, I don't want to let this subject go by without making a few comments because I was on a call last night with the CEOs from the larger counties across the state, and I can tell you on this point, I'll just say it's not going as smoothly as it is here. And I think that's a big credit to Dr. Levin's order, the thoughtful specificity, but also to the sheriff and our local police leadership and the judgment and discretion of the deputies in the field. Because this takes a lot of tact, but being taking an educational approach to it, encouraging positive compliance. I think you're getting great results with that, and we have a community that wants to respond, as you said, Sheriff. So again, there's something special here in our county. So I just wanted to highlight that.
Thank you. Any supervisors, any other questions before we go to Patrick Maynard for OES?
I'd like to thank the sheriff for the great work that they're doing. I know it's a kind of walking a delicate line. We want to support our local businesses, but those that are clearly not essential businesses that are bringing lots of people that have the potential for exposure, absolutely need that attention. And I thank you for the work that you've done towards that. Seeing now the unfortunate situation where state parks are closing their parking lots, who will be monitoring those situations? And then the concern for potential spillover into neighborhoods. I wish that wasn't the case because getting out in nature can really help people's mental state, but that seems to be the case, and a lot of the parks now are starting to close at least their parking lots and trying to keep people off trails.
Sure, I'd heard of those orders as well. Primarily in Los Angeles County, some of the beach areas were inundated with people enjoying the outdoors and a little congregating too close and such. The state parks are policed by the county sheriff as well as the state parks rangers. The rangers are the primary law enforcement agency and would be the main organization responsible for enforcing and requiring adherence to those closures. The sheriff would be in a support role in that regard.
Thank you, Supervisor Parks, for your question. Are there any other questions from supervisors? And seeing none? Patrick?
Thank you.
Thank you very much, Sheriff. Really appreciate it.
Good morning, Madam Chair and members of the board. Mr. Powers, for the record, Patrick Maynard, Director of the Sheriff's Office of Emergency Services. I'd like to start off this morning by providing you a couple of updates related to our ongoing EOC activity, and then we'll jump into some updates from our various task forces that are out there doing work. So the EOC remains activated from 7 a.m. to 7 p.m. They're there daily. We gave them last Sunday off to get a little rest, but a team of 30 plus individuals continue to do work day in and day out. That work doesn't stop in the EOC. They're actually out in the field at our various locations helping coordinate things. And I just really want to say thank you to them. They're spending a lot of time at work right now, as many of us are. But those individuals aren't just sheriff's family. They come from a number of different county agencies that lend their support to our Emergency Operations Center. So to those managers, thank you for allowing your respective employees to come and work with us. Takes the team, and again, some great work going on. In addition, I think I'll cover a few of the things that the EOC is working on. As you can imagine, the logistics piece is huge with this, especially as we've taken on securing additional hotels and things like that. We've met a lot of challenges. We're doing a lot of things that we wouldn't traditionally do during an emergency. I'll just share one with you that I thought was really interesting, and it demonstrates a great partnership that we made here locally, and we're able to keep business locally. As you know, there's a lot of requests out there for hand sanitizer. Hand sanitizer is a hot commodity right now. We're actually able to partner with a local distillery that makes spirits to purchase hand sanitizer that they made just for us. And we order a large quantity of that hand sanitizer to distribute not only to our public safety individuals, but many of our public-facing counter places where people interact and they need that hand sanitizer. That was awesome to see happen. That individual is producing that still for us on a daily basis, and he drives it over in his truck and drops it off, and we get the next batch of product out there. And again, just one of many things being done to get through this critical time. Also, I want to share with you the teamwork that's being done in our EOC, specifically in our logistics section, between the OES staff and the EMS agency staff. Those folks work tirelessly all day. They're on the phone. I mean, sometimes I wonder if I see a haze coming out of that section of the room where they're just working so hard, the smoke is building. They are working really hard to just really ensure that everyone has the PPE that they need, and I wanted to commend them for the good work that they're doing as well. The donations related to personal protective equipment, that's something that started a few days ago. We appreciate the board support, also the Ventura County Community Foundation. Since we put out a spec sheet on what it is we're looking for, we've received a ton of emails that have come in actually offering quite a few things. Every little bit counts, and as Dr. Fankhauser said earlier, VCMC, they're running low on masks. We're able to get them just a bit more. That gets us through a few more days. That's important, and that's what it's going to take to get us through this. So again, it's a team effort. Thank you to the community for providing us what you can. I can tell you we've received stuff from private residents. We've received stuff from school districts, much of which we've bought and provided during the fire. They've saved, they've taken care of it, stored it for us, and now they're providing it back to us. So it's nice to see that come full circle. Share with you kind of at a high level one of the big tasks that we've been undertaking. So we did talk last week about our endeavor to secure a couple of local hotels or motels rather, to house some of our vulnerable homeless population. That operation is well underway. Tara is going to share with you more about that in just a second. What I will say is we've had some great partnerships locally. We've gone ahead and secured a hotel here in Ventura. I keep calling it a hotel, motel here in Ventura, the Vagabond down on Thompson, and then we've also secured another location in Oxnard. Of those two locations, the Ventura location is housing vulnerable homeless residents from our county that do not have any type of symptoms and have not been exposed to any positive COVID patients that we're aware of. They've just been identified as high risk. So those individuals are here in Ventura. We're also looking to activate another facility on the East County to account for residents in the Thousand Oaks, Simi Valley, Camarillo area, and we're looking at Motel 6 out in that area, and we're looking to bring that online here in the next day or so. We just finalized the contract negotiations yesterday, so that's moving along. The Oxnard location initially was there to house vulnerable homeless residents as well. We had to pivot because we had an exposure situation at a local homeless shelter where individuals were exposed to a positive patient. And with that in mind, we had to isolate several members of our community, homeless community at that location. That has now become our higher risk location to house folks. Again, nobody at that location is positive for COVID. I think that's important for the community to know and understand. But we are putting folks there, again, to centralize all the logistics to support their respective needs. We've got a lot of security on staff. Dr. Cho's team has done an amazing job at being there multiple times a day to check temperatures and interact with the individuals. And we just, again, appreciate the ongoing support. With that, I'm going to jump into the task force update and share a few things with you. As you know, I've reported a couple times out on the number of task forces that we have, and I'll start off with the Public Safety Task Force. That's being headed up by Chief Dustin Gardner and also Commander John Riley from the Sheriff's Office. One of the big wins that they were able to coordinate, and Mr. Carroll referred to this earlier, was sharing of positive patient locations with our dispatch centers. I think that's very important. That meant a lot to the public safety community, and now they have intel prior to arriving on scene of a call, and that was something that group worked collectively, and it was a byproduct of that task force, something really helpful. So we appreciate that, and it took some work to get there, but I think the time was well spent. In addition, that public safety task force continues to work on guidelines, specifically in the law enforcement area. It's not easy to don a lot of this PPE, especially over a gun belt. So they're working on ways to do that in a better manner. They're also clarifying when PPE is required. There's still a lot of confusion, even at this point in time, about when they need to actually put on a mask and put on eye protection and a gown. Obviously, PPE is very, sparse right now, so we want to make sure we're not using it when we don't need to. So a lot of good work underway with that public safety task force. With that, I'm going to jump over to the homeless task force and invite up Tara Caruth from our Continuum of Care to talk about some of those things, and I'll be back.
Good morning, Chair Long, Board of Supervisors, CEO Powers. I'm Tara Caruth with the County Executive Office and also serve as staff to the countywide Continuum of Care. Wanted to give an update on our efforts. We have been strongly supported by Patrick and team and the EOC and really appreciate their partnership. Some of the things we are continuing is our backpack medicine team, our street medicine team with doctors and nurses and coordination from James Boyd have been in the field responding to anyone who's homeless, whether they're in a shelter or unsheltered and have any concerning symptoms. They are screening those folks and testing them in the field. We, as Patrick mentioned, we are working in close coordination with our county partners on motel sheltering. The reason we are doing this effort is because those high-risk people in a congregate shelter environment, all in the same sleeping quarters or share. If one person gets infected, the risk that everyone in that location gets infected is very high. So we have worked closely with following the federal and state guidance on how to approach this in consultation with Dr. Levin and public health and our healthcare providers. Those sites, especially the high-risk sites, are being managed by our Human Services Agency, Homeless Services Team. So Chris Russell has been leading the effort in Ventura around placing people in those facilities. They worked through the weekend to get high-risk folks there, and just the commitment from this team. In addition to whole person care serving those sites, we're doing medical screenings on everyone before they get placed into a room. We've established a client agreement and expectations to help people manage behaviors, and then are working with our service providers to keep in contact with those individuals, whether via phone or on site, managing social distancing to support them while they're in that placement. The reception from the homeless community as well as the rest of the community has been very positive. People are happy to see the county stepping up to save lives, and the homeless community is also grateful. In addition, we are working on a protocol to also have these facilities for at-risk folks who are homeless or those who may need isolation to be discharged from hospitals so that they have a safe place to go and aren't holding up any space in our hospital system. We are hearing that with our unsheltered community, food resources have been a challenge. So we are compiling, we've reached out to all our cities and nonprofits, what are the programs within each city that people can access to get food if they are living unsheltered in our community. And then we're working with our whole person care program. Deanna Handel has been key in working on these efforts and in increasing our shower and care pod locations and frequencies to really help with hygiene services and connection to medical screening. I want to say that we're following all of the federal and state guidance and reviewing those things. The CDC did put out guidance this week that advised communities not to remove any homeless encampments during this time. So we're reviewing that and communicating out with our partners to make sure we all are doing what's safest for everyone in the community. I'm happy to answer any of your questions.
Mr. Powers? did you want to add
Yeah,
something?
thank you, Tara, for the report. It's just amazing work going on with this task force. Just two things real quick, just to give a little context for people who might not know what the Whole Person Care Program is. It's a county healthcare agency program. We're one of the, I think, 20 pilots in the state to focus on high utilizers, people who are using the ER, for example, or were almost every day or every other day. And with this program and connecting them to services and community health workers, they've driven that number down by 2/3. But importantly here, it matters too because the CDPH, the state guidelines for homeless, say we need to identify the medically fragile homeless. And that could take some time, but because of this program, we already know who they are. And so that's happening. The Backpack Medicine Program is also a program from the healthcare agency of physicians and nurses who go out into the homeless encampments, into the riverbeds, and have that relationship and have that direct contact. So all of those are working in concert, so that you have a result where through the EOC, they're able to get these hotels that quickly and start placing folks that quickly, and I would say in a pretty rapid time period. So great work. Thank you.
And also, I want to say thank you to Governor Newsom and our legislators who supported the budget and also the push for sheltering our homeless in the motels and so forth. I think our team here, Tara and Patrick, and all that's done, our medical, to really, this population, we have to have diverse ways of helping. Some do not want to be sheltered at all, but we need to make sure we provide the health net security for them. And then there's also those that need critical housing to make sure that they stay away from people if they're sick and so forth. So you can't just put a temporary winter shelter in place and put 100 homeless people in one room. That's not going to solve this. And I appreciate everyone that understands that, because I know we all would like to just make sure everyone's safe, but there are difficulties and things. And so the understanding that I'm seeing and the human kindness is really amazing. So I just want to say thank you. I know that this is a high cost, but at the same time, it could be a high benefit if we can make sure that everything is very controlled. So I just want to say thank you. Supervisors, do you have any questions on this? Supervisor Bennett?
Yes, thank you. You know, last Tuesday at this time, we didn't know where we were going to be putting the homeless population, and now 1 week later, we have homeless placed, this whole program in place. I just really want to compliment Tara and her team for their ability to pull this together in a short period of time and make sure this vulnerable population doesn't both suffer any more than they have to, but also become transmitters to a larger part of the population. So my compliments to Tara.
Thank you very much. Any other supervisors? And seeing none, thank you. And we'll move on to the next task force. Patrick?
Thanks, Tara, for that. Up next, we'll have a report on our Disabilities Access and Functional Needs Task Force. Again, this is comprised of our most vulnerable members of the population, our senior community, as well as those with access and functional needs. So I'd like to invite up Victoria Jump, Director of the Area Agency on Aging, and also Melissa Livingston, who's here as well to speak on that task force.
Thank you.
Thank you. Good morning. Madam Chair, members of the board, Mr. Powers. I want to echo my colleagues' comments this morning. The work that we do is very difficult. These are very challenging times. I don't know how we could do this work without our CEO's leadership, his team's support, and your board's support. It's very much appreciated. Again, it's difficult work, and your commitment to the safety and well-being of our workforce, predominantly, so we can do this work in the community, is greatly appreciated. So I'll be sharing this morning's report on the Disabilities and Access to Functional Needs activities with my colleague, Victoria Jump. We started this task force recognizing that disabilities and access to functional needs is a very broad definition, and we wanted to start with our highest priority. And we recognized in time we might see other groups within that classification presenting themselves. But we started with our highest risk, older adults and those that had underlying health issues. And so we've broken it up into two general pieces, and Victoria will speak to specifically the piece about feeding our community and those that are homebound and hungry and potentially even food insecure. And then I'll speak more broadly about the work that we're currently doing with our home health care and hospice providers. We've been continuing meeting with them through our task force calls, understanding what their unmet needs are, strategizing about how to support those needs. And as you've heard this morning, the number one request is for personal protective equipment. And that continues to be an issue. They continue to have concerns about their ability to effectively support their patient base without that, protecting their patients as well as themselves. And so we continue to work with our Office of Emergency Services in order to ensure that they have sufficient supplies. I do want to applaud the task force. We've had ARC of Ventura step up, who had a large supply of N95 masks from the Thomas fire that they've offered out. Livingston Memorial just received over 1,000 of those.
Wow.
And they have, I think, about 4,000 more, I want to say, or maybe 400 more specifically, that they're offering to give out. So the generosity of our partners stepping up and giving to others is greatly appreciated. We have launched, as of yesterday, a survey to our home health and hospice providers. There's about 150 of those in Ventura County. And we want to reach out to them because we want to understand what they're experiencing. We, again, want to understand, do they have unmet needs, and what are those, and how can we help them? And we also want to understand what their current state is. Have they had to reduce staffing? Are they at risk of closing? So we've had a series of questions about what their needs are, as well as what their current status is as a home health care provider. And from that information, we'll rally around that to best understand the impacts to that patient base and to our community at large. We've also done significant outreach with that group to identify resources that can support them through this period of transition, especially as they may be having to make difficult decisions about reducing their workforce, if not maybe closing their operations. So we've linked them to our state EDD resources, as well as our local EDC resources that can help with business services and financial support.
Can I ask you a question on that? Our office, myself, have gotten a lot of emails and concern from the community of those that have been let go from their jobs, even companies. What else can I do to keep people employed? How can we be a critical business? And can you explain how 211 is working with us?
I'm going to report out a little bit later
good.
on 211 specifically, and if I can save it there. But
yes.
In talking to Bruce Sensley, the executive director of EDC, he's very interested in specifically in this group, because this is an important component of our healthcare provider sector, and it's been a group that has not been visible and not asked for help, and they're businesses just like other businesses that are being impacted. So he's coming around this for the first time and being introduced to a different sector that they've never supported, but looking specifically with this group. But we'll speak more broadly to in general.
Thank you.
From the 211 perspective. I also would like to thank the leadership that has come from our CEO's office through Sean Otten. Thanks, Sean. There he is in the back. I do want to thank Sean for his leadership as we've gone through a very important exercise to look at those things that we're doing that are most critical, that we must continue, and those things that maybe are very still important, but that we'll need to put to the side for a while as we get through this period of time. We're working with Sean and his team because we are setting up some call banks, and Victoria will talk about her specifically, but AAA and HSA specifically serve a large portion of this vulnerable population. And so we've done some very fast assessments and recruitments, and this morning we're standing up our call center at the Human Service Agency with over 20 county employees who have been reassigned to this work, working hand in hand with about 20 HSA employees. And what we'll be doing is safety and well-being assessments of our vulnerable population, as well as assessing what their unmet needs are. We expect to see a lot of mental health, emotional health issues that people are having, as well as a lot of basic needs that people that are presenting, and most importantly, probably the need for food. And so that call center goes live today, and we'll be sharing the information that comes from that. So again, I do want to thank our county family for stepping up there and helping out. We are also working with Food Share. This weekend, we realized that Food Share has had to change its distribution model. It has traditionally received what's called rescue food from the grocery stores. And guess what? The grocery stores don't have any additional rescue food on the shelves because of the amount of hoarding that's been going on in the grocery stores. And so Food Share has had to look to different ways to be creative in order to bring in the food that's necessary just to feed those 75,000 people that they talk about feeding all the time that are hungry and food insecure. That number is increasing now that we have many more people that are homebound and fearful to go out and get food. And so we're working with them to try to understand the number of people that we need to serve. We're looking at different strategies, and we're looking at seeing if we can procure. We're checking right now with FEMA if there's an ability to draw down funds to actually bring in an infusion of funds to help with procurement of food. We've reached out to our Public Works and GSA leadership to see if we can acquire some of our county facilities for storage of additional procured food. We reached out yesterday to VCCF to escalate the issue and the concerns, and it's being addressed at the Feeding America level today with a potential infusion of funds that may be coming to meet the needs of Food Share. In addition to that, the National Guard has just been identified as coming in as a resource to support Food Share for food distribution, so we're happy to have that support. We're also looking at reassigning some county workers to help with some of that work at Food Share and helping signing up and engaging seniors and delivering of meals to seniors, as well as potentially leveraging some of our county fleet vehicles in order to support the delivery and transport of meals and food across Ventura County. So we're very excited about the opportunities that all of those partnerships, again, thank you to our county family and our county leadership and to County Council for allowing us to look at serving outside of our county or outside of our county family, taking our county family and helping our nonprofits and CBOs that are in need at this period of time. And I think at this point, that will end my report. I'll turn it over to Victoria if there are no questions, and then I'll be back on the 211s.
Thank you.
I do have a
Supervisor
comment.
Bennett, do you have a question or a comment?
That is that I'm glad to hear that we're considering using some of the county family to help in this situation. That's exactly, I think the demand is going to far exceed any excess capacity we may have. So there's a role for everybody in the county family, and so I applaud the creativity in terms of thinking about using them and to help here in terms of the food share thing. Thank you.
Thank you, Supervisor Bennett. Victoria, good morning.
Good morning, members of the board, Chair Long, CEO Powers, Victoria Jump, Area Agency on Aging. Ditto what Melissa said about the thanks and the support that we are receiving from the county right now. I think I'm not hearing that it's the same in other counties from my peers. Just a quick update on what's happening in the older adult services world. Most adult daycares and adult day health care centers are now closed. However, just to show you the resilience of the senior community, we are seeing that many of these centers, although they're closed, they're still working with their families to try to provide services to that older adult in the home. We are receiving a lot of food donations, but also volunteers, which is great to help our effort. Over the last week, we have seen an additional 1,150 people sign up for our senior nutrition program. Currently, our senior nutrition role, like on a given month, is about 4,000 people, and so an additional 1,150 people have signed up in the last week. But we can meet this need. We have our city partners who are helping, but we also have a fabulous disaster service worker crew from the General Service Agency who are helping us put food bags and bring them to people as soon as we can. Over the last 3 days as an agency, we've distributed over 7,700 meals. We're trying to do our part to keep people that are most vulnerable at home, out of the grocery store if they don't have to be there. What we're seeing is mostly low-income people of all ages that, some may have cancer and have a compromised immune system and can't, shouldn't leave the house. We're seeing a lot of 85, 90, 95-year-olds that are, terrified to go, and their doctors have told them not to leave the house. So we're getting requests, across the age span. Melissa did mention that as part of our task force. We do have ARC there. We are able to help them in the disability community as well. Their day program has shut down. And so they have people that live independently that go, there for services. And so we have provided food to them so that those people can work with their social worker and they can help them cook the food so they're taken care of. So that's my update. Oh, and I guess Melissa did mention that we are working with the Human Service Agency because we serve a lot of, we have some same clients, but we serve, mainly very vulnerable people. And so we're also having our phone bank to, do the well check calls on our clients just to make sure that they're okay and that, if there's some kind of need that we can meet, then we'll try to see what we can do.
Thank you. And also, I have friends that are checking on their seniors in their neighborhood and asking them, do they have a shopping list? Can I go shop for you? Do we have suggestions on dropping the food off at the door? Is there anything that we should suggest to our community?
So we're suggesting that, one, if neighbors can help out neighbors and do the shopping, it's less of a burden to our whole system. It's less of a burden to food share. So we would prefer if people could reach out, get to know their neighbors, do the shopping, help out. We are, trying to minimize the contact with older adults. And so right now it's, putting the food down at the door and calling them. Everybody's wearing, gloves just to be careful because we are, we don't want to transmit something into somebody's home that is safe.
Thank you. Supervisors, do you have any questions for Victoria? None. Thank you so much for all the work that is being done. I appreciate the call that you took for me for pies. Everyone calls our supervisors and everyone else, hey, I have this, who can take it? So I just appreciate the quick input to make sure that we can do what we can. Melissa, did you? Mr. Powers.
I was just going to say, and in the background, a lot of these efforts, GSA is helping to support from a logistics standpoint for senior meal delivery fleet by focusing on essential services. We free up some capacity, but even that is maxed out a bit. And they're also looking at working with rental car companies, basically whatever it takes, whatever you need to get it done, and also helping with the hotel contracts as well. Thank you.
Yeah, I think we've been very fortunate since the inception of 211. Actually, I believe 211 originated in Ventura County, and we've been very fortunate to have 211 as our main hub for resource and referral over the years, and we've relied upon them heavily. They're being slammed hard with phone calls, and they not only serve Ventura County, but they serve 9 other counties, and during or 12 other counties, I believe, and during times of disaster, they pick up 9 additional counties. So they're staffing up excessively in order to meet that call volume. The call volume has grown exponentially. Just at the level of all of those counties I've just mentioned, there's about 4,000 calls a day. They're only able to get to about 2,000 of those calls just because of the nature of the need for staffing and the enormity of calls coming through the network. That's one of their first concerns, but the greater concern, which is important that your board understand today, is that our social service network has become fractured. It's become fractured because we've seen so many of our nonprofits that we rely upon in our community. They have had to shut down, close down, they're laying off staff. They may be teleworking, but they're not providing the same level of services or any services at all due to the virus event. And because of that, we're struggling with being able to connect people to the resources they need in a timely fashion. And so we've been looking at the types of calls that have been coming in. And in this past week, they moved from questions about the virus and how do you get it and how do you mitigate it to questions about, I'm having mental health and emotional health issues. I need to talk to somebody. I don't have the most basic of needs. I'm hungry. I can't feed myself. I can't feed my family. And so obviously those are very concerning when we move from questions to needs of that nature. And when our system isn't functioning at the highest level that it possibly can. A perfect example is we can make a referral to a food pantry in a city, but that food pantry may no longer be open because we're seeing food pantries closing quite quickly. So we're in some instances sending people to dead ends. And we recognize that that's not how we want to do business. And so I have been working with Interface 211 Executive Director Eric Sternan and his team and BCCF Vanessa Bechtel put our heads around how we're going to solve this issue. We sent out 211 sent out a survey to all of our nonprofits on Friday, and that survey was to assess what's your current state. Are you functioning? Are you open? Are you closed? What services are you providing? What do you need? What can we do to support you? So we're looking at getting an understanding of who's available and what services they're providing so that we can map the gap between what we have in our community from a service perspective and what we don't, and then decide what we need to do to fill that gap. We've already looked at how we can repurpose some of our county workers to support that. I reached out to our Director of Behavioral Health, Savette, last night and said that 50% of the calls that we're receiving are individuals that are having mental health and emotional issues. Some people are even concerned about dying and verbalizing that in these phone calls. And so we're looking more at how can we triage these calls up front rather than addressing them through a referral system. And so I'm working with Savette to see if there's any resources available within her team that we can put on the front line to help address this issue. As you might guess, Vanessa Bechtel sees this as an urgent issue and is working together with us to move quickly, to do whatever we need to support this. Amgen has come in to help with some technology solutions to help us stand up a database that will allow us to have a community information exchange that we can begin communicating with all of our partners that are in the network that are providing services so we can quickly triage and engage all of the nonprofits that are functional to assist us during this period of time. Very challenging times. We never expected our social service net, safety net that we rely upon to not be fully functional. So I'm happy to answer any questions.
Thank you. It's really important to me, the food. We've been getting lots of, I got a text today, Kelly, how can we get these families that have been let go some food? Can we give them a debit card? Can we give them, what can we do if the pantries are closed or they don't know where to go? How do we reach for it? And so I appreciate hearing that we're looking outside the box to try to figure that out, because that is the case. You know, what food bank is open? Is that only seniors? You know, I have a family trying to find a new job, or the EDD check is not coming through yet, and I've filed for unemployment. So I appreciate that. Also, 211 is looking for volunteers as well for on the phone, correct?
Yes, they are. They actually have a online training program so people can train remotely, and they can even perform the functions remotely. So they're casting a wide net. We're making a request within our county family to assist with 3 different levels of functioning within their infrastructure, some for project management to help bring some of the local groups that want to help together and coordinate those projects to help with meal delivery, prep and meal delivery, as well as as stated, getting a large cadre of resources that can help with the well-being issues that are being presented.
Okay, Mr. Powers?
Thank you, Chair Long. Just 2 points to make and appreciate the good leadership of Melissa and Victoria. When we're talking about food, I just want to make it clear to your board, because I know how you would feel about this. We've made it very clear to both of them that if whatever program is not providing the food, just go get it. We're talking about, we cannot have people going hungry in our county. So go get it. We'll fund it. That's one of the reasons we're seeking funding flexibility from your board later today, have already done so. And at the same time, we're coordinating with Patrick Maynard that a good bit of this funding may be reimbursed by FEMA, given the major disaster declaration. So, but again, it's just that philosophy. If you need it, go get it, and we'll support it.
Right, and also for our neighbors, check in, not visually being away from 6 feet, but check in with your neighbors to make sure they have the food and the things that they need. You spoke about hoarding, and that is an issue right now. There are people that have had supplies that maybe will last for years on end, but if we could check in on each other, I think it's really an important factor. At least okay, my neighbor actually needs food. Tell them 211, or maybe you provide something for them. See how we can reach out. And I think that's going to be really important for us in the long haul, because we're not done tomorrow.
And a message, and a message from CEO of Food Share, Monica White. They are accepting donations, and I made mine this morning. So call to action to help Food Share, because they're not receiving food through their normal channels.
Well, one other point, thank you, that we've touched on is the mental health of these seniors too, and want to make sure the community is aware that the Behavioral Health Department does have an older adults program that works with these homebound and frequently isolated seniors to provide psychiatric care and medication and case management services for them.
And then also Food Share, it does have a volunteer list on their website, and that's for packing food, also for picking. We have a lot of private homes, land that they want their orchard picked or something. So there's a lot of different ways I think our community can help with Food Share and 211 to help that as well, with donations and so forth. I think that's important.
Yeah, Food Share has put out a request not only for volunteers and donations, but what we're recognizing also across our social service network is that the majority of volunteers that support this infrastructure are 65 and above. And so we've got some work to do going forward. We have a lot of folks stepping up at that lower age, and there's an opportunity, to grow that next generation of volunteers.
Yes. Supervisors, do you have any questions for either of these two?
I think that Melissa makes a really good point regarding the volunteers that we have. So many of them are seniors, and I hate to see, folks in their 70s going out to the stores to buy food to get them to people who are younger but are of such low income that they can't get food. So that to me is really important to realize that those individuals need to be staying at home. The idea that you mentioned, Chair Long, about a gift card, that could enable the individual to go out and purchase. Also, this is the first I had heard and hadn't thought of, the fact that because you have had people doing hoarding, that it has precluded places like Food Share to actually get the donated leftover food at the stores. And so I think people need to take that into account too as they're going out and buying, like you say, a year's worth of supplies. We had the potential of an SCE outage in an area in my community, and someone complained that, we've got people here who have their refrigerators full, that, that food's going to go bad. And I'm thinking, what about those who don't have much in their refrigerator? We really need to be thinking about others in so many different ways, as well as, of course, staying at home so we don't spread the disease.
Agreed. Any other supervisors? Supervisor Zaragoza?
Madam Chair, I want to thank Melissa. I think that she shares something extremely important, and that is the mental health, that we need. I'm glad she's working with mental health individuals. Food is very important, and I want to thank Food Share for stepping up like always. And additionally, what I like to share, not sure if anybody else is going to speak, but I want to thank the CEO's office, Dr. Levin, Rigo, our Sheriff Department, and thank all our county agencies for the partnership that we've formed here in the County of Ventura. Our CBOs, our residents, for their help with this horrible pandemic that we have. This is unprecedented times that we're experiencing now. And again, 211 I think is extremely important. But I want to thank all the individuals that are working to keep us safe here in the County of Ventura. And thank you so much.
Thank you, Supervisor. Okay, next item up, assistance. Patrick. Thank you, ladies.
Thanks for those good reports. Just lastly, to cover our last two task forces, the business task force headed up by Mr. Paul Stamper of the County Executive Office. There's a lot of work underway. Just a reminder, Ventura County was approved by the Small Business Administration for low-interest loans. So if you do have a business in Ventura County and you're in need of financial assistance, those loans are available. Information, of course, can be found on our website, vcemergency.com. There's a section on there specific to business. And in addition to that, there's actually a guide, a resource guide that's been created for businesses that they can take a look at. It's available in English and Spanish to help them along the way. On the education task force, not a whole lot to report at this point, different from last week. Schools are obviously still closed. They are active in the conversation and, again, have been a great help in our ongoing effort to obtain additional PPE. Lastly, I'll just close by sharing with you that a number of funding sources have been made available to us to respond and prepare our facilities for the coronavirus. In particular, most recently, 2 days ago, in fact, a federal major disaster declaration was approved by the president. That request was made by Governor Newsom and in record time was approved 2 hours later. Sometimes that process takes several days. With that, many of the services we've experienced during the Thomas fire will come into play here locally. I think one of the unique challenges we'll be faced with in the next few weeks and months is determining how we can ensure that our local residents and businesses take advantage of those services. Typically, we would set up a local assistance center, but due to the social distancing, that may not be the best of choices. So I have been talking with some of our other counterparts up north as to creating a virtual local assistance center to make those things available. And again, of course, as that develops, we'll continue to update the board. But that concludes my report, and I'd be happy to answer any questions that may not have been answered.
Mr. Powers.
I want to just supplement a point, Patrick. Thank you on the businesses they impact, and we know what a huge impact it's having on our local business here, big and small. I want to highlight EDC, Economic Development Collaborative. Bruce Tinsley, working in close partnership, is a great resource for all of our small businesses for things like unemployment payments, paid leave, small business loans that Patrick mentioned, and also our local chambers. We're coordinating with them very closely, and we're so fortunate to have their great advocacy. One of the things they're advocating for, in fact, today is that today is the Great American Takeout. So they're really trying to highlight the importance of takeout from our local restaurants who are still, the doors may be closed, but the kitchen's open, I think is what they're saying. So again, I want to make sure we highlight their efforts. And I want to really thank Patrick. This is huge. Big fires and all these other disasters are also big, but this is big and completely unique and uncharted waters and territory. So you have to have the kind of nimble leadership that he provides. So really appreciate the leadership and partnership, Patrick.
Thank you.
I would definitely join you on that. I stopped by the EOC, I think it was this week, and it was very calm. But at the same time, they're taking the steps to be able to be distanced as well. And if in EOC, when you go to the command center, everyone's there and they're huddling and they're quickly activating and they're on spot talking to each other. Well, you can't do that in this type of situation because that's too many people. And to think out of the box, to be able to still be doing all the functions that we need to do and be somewhat virtual in certain things, I think is very impressive to be able to do that. And some of the demands that are being put on right now, like getting a motel tomorrow, certain things, the supplies, walking over personally to drop off masks that are needed is pretty impressive. I just want to say thank you to all your team, all the departments teams that are really pushing this on. One question I had was your case management, as we saw with Thomas Fire and all the other fires we've had in the last 3 years in Borderline. How does, for example, like rental assistance, would that play into play here? Those are things I would like to get more information as we roll these type of things out, is to find out how those systems now work and how does it improve what we're doing. Mr. Powers.
Yeah, excellent question, Chair Long. And the rental assistance homeless prevention rapid rehousing program is ongoing and continues to be a very positive, impactful program. But that may be one of those things as well that we're talking about additional funds we may need to do that as well, to make sure we keep our folks housed. Thank you.
Thank you. Supervisor Parks, do you have a comment?
Yes, thank you. I did also want to extend my thanks to Patrick specifically. He is staying on top of all these different task force. He has great leadership, very welcoming and very patient. And I just really appreciate the many hours you're putting in and the great outcomes that you are getting with these task force, the report back, and just really appreciate it. I know you're doing a lot more than any of us really know, but just thank you for the good work that you're doing. Much appreciated. And also being new to the position too. So I'm just keep up the great work, and that goes for everyone, and not the least of which is Mr. Powers, who has just the amount of hours he's putting in, the hard work that he is doing, the incredibly good coordination. And as we've heard from several staff, we are unlike other counties because we are working together. Our departments are working together, and we have also great partnerships in our community. And at a time like this, it is so needed. And I just really appreciate having you at the helm, Mr. Powers. Thank you.
Thank you very much. Any other supervisor comments? Okay, you're off the hot box.
Supervisor Huber.
Oh, Supervisor Huber, yes, please.
Yes, thank you. I just wanted to say thank you to our dedicated county staff for these thorough continuing reports to educate our residents regarding protecting themselves during these challenging times. Thank you very much.
Thank you very much, Supervisor Huber. Mr. Powers.
Thank you, Chair Long. Just a few more reports. We're almost there. Next up, we have a report from Human Resources, our workforce update from our HR Director, Sean Otten.
Is that item number 9, or is it still?
It is still there.
I
thought they were done.
Good morning. Good morning, Chair Long, members of the board, Mr. Powers, Sean Otten, your Human Resources Director, and it is really very humbling to hear all the work. The county engine is going at full force and being very effective. And for our part in human resources, we try to be the oil in that engine, facilitating the work, the good work that departments are doing. So in the last week or so, since our last report, we've really stepped up encouraging everyone who can telecommute to telecommute. We now have over 3,000 employees of our 8,700 or so regular workforce telecommuting, and there are others who are changing shifts, or there's alternate work arrangements that are occurring. So really, if you look at the parking lot, you actually notice the difference. And if you look in our lobbies of the various buildings, you notice that employees are working from home, and they are changing their work patterns to give us social distancing. We are also working very hard and diligently with our departments, and I have to give some kudos to my staff. Katie McKinney has, as an example, really stepped up and has partnered with the healthcare agency. They are the tip of the spear in many aspects, and she has been, I think, a trusted partner, starting with the nurse job fair, where we had 38 job offers out there. But really, there's been so many reassignments due to the critical needs within and outside the agency. That's our task. And Matt Escobedo, just this last weekend with 6 or so people, we're calling everyone to reassign the Melissa and Victoria Jumps reassignments that they were talking about. So we're really trying very hard to answer the department's questions regarding the emerging issues that arise. And we're also working with our union groups. We've met with several of them. They have concerns, understandably, and we have, I think, our good efforts as a county as a whole have really answered a lot of their questions. But of course, they have a lot of ongoing questions. not least, but most importantly, I should say, are our employees. We have a surge of questions from our workforce. And I just want to go through some of the functions that we have. Our employee assistance program, for example, we know that we just went online with video conferencing. So Anna Kumar with our EAP, they're getting a lot of calls. Our benefit staffs are getting a lot of calls with employee concerns as these issues arise. Workers' compensation, there's a lot of questions coming in about employees who are anxious about the COVID virus, and we're guiding them through. And anyone who's looked at the 401k, their 401k will regret it recently, but today is a good one. We're getting a lot of questions on the 401k, their retirement questions. So our staff are amping up to really try to facilitate what the departments are trying to do. And that's my report for today. Thank you very much.
I would like to say thank you so much. Sometimes when we're pushed to do more, a lot of people just say we don't have the staffing to do that. Sorry, we can't do that. And I haven't heard that today. I have not heard that message at all. All I've heard is that people are stepping up. People are working as hard as they possibly can to fill the need and really provide the service that our county is here to do. So I just want to say thank you, because that takes a lot, and a lot from our employees to be flexible too. Change is hard for people, but I just thank you for all the efforts that you guys are doing. It's really impressive.
Thank you. We're very proud to be part of this team.
Mr. Powers?
Yeah, Sean and the HR team working with all the departments to really, if there's folks that we can reassign, it's all hands on deck. And we just appreciate the attitude, which is no surprise. Everybody here is very mission driven in our county workforce. And so people are eager to jump in where needed. And so really appreciate that. Also wanted to just mention, we mentioned, and you raised a good question about homeless prevention, rapid rehousing, rental assistance, and, we may need to supplement that, and we'll be ready to do that. But at the same time, there's a capacity issue there too, so we may need some additional staffing with that program. Chris Russell and his team just do a phenomenal job, but they're also the same people who are placing the homeless in the hotels. So, we're going to have to continue to just build capacity, and that's what we'll do, because everybody has the right attitude here. Thank you.
Right, appreciate it. Supervisors, do you have any questions?
Yeah, Madam Chair, this is Supervisor Zergos. I want to thank Sean Otten for keeping our unions up to speed and our employees. I think it's important that they understand, what we're doing and how we can help our employees. I want to thank you, Sean, for that. Thank you.
And yeah, thank you, Supervisors. And last up, and most certainly not least, I'd like to invite our PIO, Ashley Bautista, to come up and give us an update on all the great engagement work that she's doing and leading the Joint Information Center for our county. Ashley.
Thank you so much. Thank you, Chair Long, as well as Mr. Powers. We still continue to advise our community to stay connected at vcemergency.com. It is filled with a wealth of information, especially information about the order from Dr. Levin. It's really important that our community members, when they have questions about essential business services, that they take time while they're staying home to read the order. The order really spells out which businesses can operate at this time. So I really encourage the community to visit that site. Our social media has become a resource for up-to-date updates on this evolving situation. Just yesterday, our update had over 204,000 hits to just our update post. We also had, over the last week, 763,500 clicks on our county Facebook page. I share that because our Facebook page especially has become a resource for our county. It's a great location to get up-to-date information. If you are not on social media, that's okay. We are also doing radio interviews, TV interviews, print interviews. Our goal in both English and Spanish and some of the indigenous languages in our county is to keep our community members informed. The more informed you are, the better you can know that you need to stay home. So we also kicked off our campaign this week with our doctors. If you visit our pages, you will see our doctors encouraging you to just stay home. I encourage our community members to join us. Join us with your videos of what you're doing at home. Hashtag Ventura County Strong. If we can come together while staying apart, our community is going to be stronger for it, and we're going to save lives. And at the end of the day, that's what we're here for. We're here to save lives. And so our communication piece of this is educational. keeping the community informed, answering questions, and making sure that our residents know where to go for up-to-date information. VC Emergency is updated every day with case information, including where the cases are located throughout the county, as well as the number of tests that are provided by both public lab as well as the private lab. So it's really been an honor and a privilege to represent the county in this and just see the community support for our doctors and nurses and frontline first responders. So thank you so much. Again, I encourage our community at County of Ventura on Facebook. Join our group there, also in Spanish, and it's an opportunity to ask questions and stay up to date with information.
Thank you, Chair Long and Ashley. So one thing I want to make sure we touch on before we go as we talk about vulnerable populations is our very important farm workers in our community. There's anywhere from 40 to 45,000 of them. They're such a huge part of our economy and our community. I mean, they put food on all our tables. And so we are really focusing our effort, as is Ashley and our office and HSA and everybody, in large part through our Farm Worker Resource Program that your board established with our leadership there, who is trilingual in English, Spanish, and Mixteco, but they're also communicating to them with videos in their indigenous languages, including Zapoteco and Purepecha, and going out into the fields to meet with them to help them understand just what is the COVID virus, what are resources available, how to protect yourself, and that kind of thing. So supporting our farm workers during this critical time is a high priority for us, and we know it is for your board. Just lastly, two last points. I also want to recognize and appreciate the County Council's office. A lot of this work putting all this together. There's a lot of moving parts here. We want to make sure we don't wander off into high-risk areas, and they're working around the clock to help make sure that we're able to move forward quickly in a compliant way. So really appreciate that work, as well as our auditor controller, and a lot of moving parts with all these fiscal pieces too. So the only last comment I would make is that we're coordinating really well, I think, together, county departments, city, community-based organizations, schools, everybody, chambers, the businesses, but we also recognize we can't anticipate everything, so we have to be nimble. We're always looking for the gaps, and so we appreciate those who point out, hey, don't forget this area, don't forget that area. We need to hear that. We're building this jet airplane in the middle of the air, and so this is a collective effort. We welcome those thoughts and areas where we can improve, and just the continued engagement and great compassion that our employees in our community are showing. So, thank you.
Ashley, mic's off. Ashley, I just would like to say thank you. I don't think I've seen so much information coming from our multiple different departments out into our community. It's been really impressive. I know Facebook is not the only vehicle in which we're explaining things to people, and to make sure that our seniors know it, people that don't have internet that are getting it on the phone or through the radio. Really appreciate it, especially the multiple different languages. It's been very powerful. Having people understand what our testing is and how many positives we have every day is reassuring to people to understand where they are. And so I just wanted to say thank you very much about it. We do have a public comment. So supervisors, do you have any questions for Ashley before I go to public comment?
Madam Chair, this is Zergos. I just want to thank Ashley for the excellent work that she's doing, especially communicating with the Spanish-speaking community. And the resource worker program is working great. Well, in fact, they're using one of my conferences room here, and I see them working diligently. So I want to thank you, Ashley and Rosa, and all the folks that work on this. They're working on the PIO's efforts. And again, Mr. Powers, excellent job with your PIO staff. Thank you so much.
Thank you so much. Okay, Rosa, you have a public comment to read?
Yes, thank you. We received an email from Monica Gray, and it reads, Dear Board of Supervisors, as the mother of an extremely medically fragile child, I am hoping to stay far, far away from any hospital during these crazy times. I expect the county to do whatever it takes to secure adequate personnel protective equipment for those inpatient contact settings and first responders. I know scores of industrious people who are busy sewing masks and covers for them, so they will last longer and will be, quote, better than nothing, unquote, which is awesome, but also a little scary. Why does the Grandma Brigade have to come to the rescue when we should have better prepared for times like this? I have also read stories where 3D printers are being used to make respirators. Desperate times call for innovative measures and people willing to help their neighbors. Please allow allow the helpers to help from a safe and sanitary distance. Upper Ojai Relief is doing an amazing job of helping most of our vulnerable. In other counties, if other counties can manage to get the critically mentally ill off the streets and into treatment to stop the spread, why can't we? As one of the best places to live in the United States, we are capable of doing this. From more focus groups, more stakeholder meetings, build the facilities, and to stop the spread now. They needed help long before this started, and now it is more critical than ever to get this done. We are counting on you to do the right thing. Some of these people don't even know what day it is, let alone that they are sick and making others sick too. Instead of spending my days worrying and wondering about all the things I can't control, I choose to enjoy this time with my kids to cook, bake, craft, and clean. I'm really glad I have so many art supplies right now. If there are any opportunities for me to help find any additional funding sources and assistance from our county, I would love to know about them. I can help. Be well.
Thank you very much. Are there any other public comments that were turned in for this item? Okay, and seeing none, closing comments. I'll open that up to supervisors. If you have any closing comments on this item number 8.
I do.
Yes, Supervisor Bennett.
Yeah, just that we're on, we're right on the eve of the battle, and we've done the best we can in terms of getting ready, and now everybody's got to gear up. And as Mr. Powers said, the next couple of weeks are really going to be crunch time for us and stuff. So I wish everybody well, but I hope everybody will inspire themselves to perform at their peak and make this an effort that when we look back on it, each one of us can look back with real pride that we did something for our whole community. Thank you.
Thank you very much, Supervisor Bennett. Again, just impressive how the response is for our team. With this, it's going to be a long haul. And so I just urge people, if you can get sleep, if you can get some exercise, if you can stay away from people, really appreciate it. We're just trying to keep our community very healthy and functional. So I really appreciate all the hard work of Mr. Powers, all the team, I mean directors to just everybody. This is a team effect, a team job to do. And so just say thank you so much.
Madam Chair.
Yes. Supervisor Zaragoza.
I just want to add to that. Again, as I mentioned earlier, I just want to thank our county family and our great leader, Mr. Mike Powers, and all the residents and all the volunteers we have here in Ventura County. Thank you so much.
Thank you. Mr. Powers.
Thank you, board members, and thank you for continuing to connect with us, giving us your ideas and connecting us with your constituents as they have concerns. It really helps us do things, and just your ongoing support. Thank you.
Also, again, the federal, the state, all of our legislators providing the funding that we need to do this job is really important. So I just want to say thank you. They've been working very quickly about it. I can't forget about them. So this is a receive and file. We will now move on to item number 9. Thank you. No, this was just an informational receive a report regarding. There's no motion to approve from what I understand. Thank you.
Good morning, Chair Long, members of the board, CEO Powers. The item before you, as we've just heard, many in our communities are impacted by the COVID virus. And as part of that, some have lost their jobs or they're affected medically, and that can have an impact on their ability to retain housing. And so as part of this item, we wanted to provide you an update of efforts across the state and here locally to possibly bring some protections in place for evictions. And so towards that, wanted to give a brief report, and then following that, get some input from your board on directions concerning potential protections by the county in the unincorporated area. On March 16th, 2020, the California governor issued Executive Order N-2820, which extends the protections under Penal Code Section 396 for evictions through May 31st, 2020. The order, in effect, makes it unlawful to evict any residential tenant until the state or local emergency is canceled. County legal professionals across the state have since reviewed this order and indicate that further local protections may be necessary should a jurisdiction seek to implement a version of protections that is more resilient to challenge. In accordance with this order, many jurisdictions across the state of California have since enacted local eviction protections for residential, commercial, or in many cases, both types of properties. Here locally in Ventura County, of the 10 cities, 6 have already enacted some form of eviction protections. The cities of Ojai and Thousand Oaks have issued moratoriums on residential evictions. The cities of Camarillo, Moore Park, Oxnard, and Simi Valley have issued moratoriums on both residential and commercial evictions. And the cities of Ventura and Fillmore are considering similar protections at their upcoming council meetings. Across the state of California, over 30 major cities and counties have already adopted similar eviction protections, and more than 14 have such protections coming before their elected bodies for consideration in the coming days and weeks. The United States has not yet passed a blanket national moratorium on evictions, but has enacted suspensions of some government-backed evictions and foreclosures. Additionally, the U.S. Department of Housing and Urban Development on Wednesday, March 18th, authorized the Federal Housing Administration to put an immediate moratorium on foreclosures and evictions for the next 2 months for single-family homeowners who are unable to pay their FHA-backed mortgages resulting from the COVID-19 pandemic. The Department of Housing and Urban Development is also encouraging public housing authorities not to evict tenants who do not pay their rents on time, and is working with Congress to give the agency the authority to prevent evictions in public housing programs. Current eviction protections across the jurisdictions listed above have generally taken the approach of temporary suspensions or moratoriums on evictions and do not relieve the tenant of liability for unpaid rent, nor restrict a landlord's ability to recover the rent due. Some common components of the local eviction protections implemented are the following: temporarily coinciding the protections with the state of local emergency. The common provisions include that the tenant must demonstrate cause, either medical or financial, associated with the COVID-19 emergency. That there must be a provision for requiring documentation of impacts within a specific time frame, typically 30 days, that the tenant must notify the landlord of the impact in writing. Other provisions include not relieving the tenant of liability of unpaid rent. Some jurisdictions include a time frame, for example, of 120 days to pay the past due rent that is due. Many of the restrictions also include mobile home parks, lessors and sublessors in their terms and guidance, and they do not prohibit proceedings that were already in progress prior to the declaration of the local emergency. And some jurisdictions include suspensions of foreclosures. For example, San Luis Obispo County has implemented such a provision in their protections. So with that, that concludes our brief report on eviction protections in place, and we would entertain any guidance from your board on such a ordinance or protections here at the county.
Did you ask? I didn't hear you. Did you ask?
There is a public comment. I wanted to make sure we heard that before we start to discuss the matter. Rosa, is there a public comment?
We have not received any further.
Okay, there is a public comment. I'll just read it because we're just going by the fly. It's the Apartment Association of Greater Los Angeles, and to make sure that the supervisors have this letter, in which is from Daniel Yulkson in regard to this consideration of adopting urgency ordinance temporary suspension of eviction. And so if you could all read that letter, it's in support of it. So, okay. That being said, there's no other public comment with that. And supervisors, why don't I start with you as to anyone's comments on this?
Supervisor Huber?
Yes? Supervisor?
Yes, thank you. These are serious and difficult times. As a community, we are coming together to combat a deadly and highly contagious virus, as we know. Part of the actions we are taking together has or will have a negative impact on people being able to pay their rent. It's important that we not only fight this virus in the toughest manner, but also find compassion towards those who have lost jobs and income. I certainly support an effort to provide eviction protection to renters that have lost their jobs due to our community due to the battle of COVID-19. In addition, we need to keep in mind that no good deed goes unpunished. We need to make sure to prevent those wanting to take advantage of the generosity of our community and intentionally fail to pay rent, even though they have not been affected by our stay-home-in-place county policy. Also, we do need to keep in mind that property owners should not have to shoulder the generosity on their own. We need protections as well. I'd like to see a policy that requires that renters to submit proof of loss of income due to stay well at home policy and the state's COVID-19 response, require renters to start paying rent once they have secured a new job or the needed financial aid. And once the renter is back on their feet, they should be required to pay back most, if not all, of the rent required. Thank you.
Thank you, Supervisor Huber. Is there any other supervisors that would like to make some input on this?
Yes, I
Supervisor
would like
Bennett?
to, thank you. I think I can turn my camera on here now too. There we go. Yes, it's very clear that there are people that need to be protected in this situation. And what I hope is that landlords, both on the residential side and the commercial side, will be considerate and take this all into consideration. To the extent that that doesn't happen, I do think we need a policy, but as Supervisor Huber pointed out, we need a policy for people that truly have a hardship as a result of not receiving their income. But I want to make sure that we don't create a policy that encourages people to take advantage of it who perhaps didn't lose their income, but just view this as an opportunity to not pay because they feel like the landlord is hamstrung in this situation. So I just would like to direct staff, we won't be able to come up with a perfect policy that blocks everybody from taking advantage of it and still provides the appropriate amount of compassion. And if we have to err, we have to err on the side of compassion. But at the same time, I'd like to just make sure that our staff thinks through in the direction with direction from the board to try to craft as intelligent of a policy as possible. And I think some places have just done it very quick and haven't thought it through, but try to create a policy that's intelligent as possible, that minimizes the chances for abuse, but makes sure that people that have true hardships are able to demonstrate that and not be evicted. Thank you very much.
Thank you.
And the other thing I'd like to point out is it seems to me, just like this issue was not something on our radar screen a week ago, to the extent it is now, just like some other things have come up, I actually think I think we should have a scheduled board meeting every week that we just count on having, and it can be canceled on Friday if we feel like there isn't anything we need, but that we shouldn't take a week off, not in the first few weeks here of this battle we're getting ready to enter. So I would like to combine, particularly this, perhaps staff would have something ready next week. By then we'll be getting close to the first of the year and rent payments due and all of that. I mean, the first of the month and rent payments due. So I would like to request that we schedule a meeting for next week, because right now we're not scheduled for next week, and that we plan on meeting each week until we make a different decision on that.
Thank you, Supervisor Bennett. Supervisor Parks, did you have any comments? Okay.
Supervisor Huber?
Yes,
Supervisor
Huber.
I'd like to agree with what Supervisor Bennett said on the weekly discussion. I appreciate his thoughtfulness on that.
Thank you very much. I think we could all agree on the importance of having these meetings to make sure we're doing the best we can. One thing I would like to just suggest is that you do take in consideration the letter that was sent in for public comments. It was also copied to Ventura County Coastal Association of Realtors to make sure that we are doing the ordinance for those in need and not creating a fraud situation. I think we all agree to that. We saw with the Thomas Fire, when we help with certain things, there is a very small percentage that tries to create fraud. So making sure that our landowners are protected from that. And also,
Supervisor Long?
yes,
Madam Chair.
Yeah, if I
yes,
could.
Supervisor Bennett.
Yeah, one other thing. My request for us to meet weekly, I would like to have the meetings during this early emergency time be limited to only essential items, only essentially COVID items. Right. But unless there's some other essential item, but everything that's non-essential, I don't want staff worrying about creating a report and the CEO's office worrying about reviewing a report and all that for anything that can wait. So these agenda items should be limited to just the things that we really need, the updates and items like this that are related to the virus.
Thank you for
That'd
making sure.
Suggestion.
Thank you for making sure that wasn't our assumption, that is only essential items that we would be meeting for. Thank you. And then also, I would like to just make a comment in regards to the property tax. As the property owner cannot evict people, they're paying our property tax. And Sue Horgan has been very good at providing information to those who have contacted us in regards to property tax deadline being April 10th, and that the state legislation and governor has not extended that time frame, but that the tax treasurer collector's office is considering request of waiving the late payment penalties, and that is on a case-by-case basis, but we won't get there until April 10th. So I just want to make sure there's always a cause and effect. And I want to make sure when we're taking care of renters, we're also taking care of the property owners as well. So I want to make sure we're not forgetting about that. So I would appreciate, if there's no other comments, that we could get a motion to move forward.
I'll move the item.
Thank you. Supervisor Parks moves the item. Can I get a second?
Well, I don't know what move the item means. I mean, we needed to provide direction. So could the motion include our comments about weekly meetings and our comments to direct staff to do everything they can to try to minimize any potential fraud with any efforts to have moratoriums on evictions?
Okay, so the motion is to receive a report of the status and to provide feedback. And so that's what we are doing today. And that would include our feedback on the meetings as well. Is that clear? Okay, so it's been motioned by Supervisor Parks. Can I get a second motion?
Second.
Second by Supervisor Bennett. And if without any further discussion, all in favor say aye.
Aye.
Any noes or abstentions? Motion has been approved unanimously. Thank you very much. Moving on to number 10, which is our adoption of a resolution authorizing the pay of employees pursuant to Section 1804 in the Ventura County Personnel Rules and Regulations due to natural disasters. Mr. Otten.
Thank you. Good morning again, Chair Long, members of the board, Mr. Powers, Sean Otten again. I'm here before you today to ask that your board invoke Section 1804 of the Personnel Rules and Regulations. And on approval by the CEO or his designees, authorize the auditor controller to pay full wages and benefits to regular employees who are unable to telework and who, after our best efforts to assign them to other essential functions, have experienced an absence from work due to the COVID-19 epidemic or pandemic. The period of payment eligibility will be from March 4th, so retroactive to March 4th, through April 4th, providing that no payments are made in excess of 80 hours, so a 2-week period within that 4 weeks. And in anticipation that this may be a protracted crisis, to authorize the CEO to extend payments during an additional 2-week period after April 4th. So it can be any other 2-week period while the declared emergency continues, if it's warranted, of course. So we anticipate that the annual fiscal impact of this action will be approximately up to $3 million, if up to 400 people take advantage of it. It should be noted, though, that the county would need to pay a portion of this cost regardless of this action. There was a recent enactment by President Trump of the Families First Coronavirus Act. This federal mandate requires that the county to pay up to $200 or $511 per day for 10 days to employees who miss work because their child is sick, because their school is closed, or who are sick themselves. It's $200 for the $200 for the school closures or childcare, and $511 per day for sickness. That's a maximum of those amounts, but 2/3 of their wages up to that maximum. In addition to that, there's another 10 weeks of emergency FMLA for which they would be eligible due to childcare issues or school closures to receive $200 per day. So that's $10,000 in total for those additional 10 weeks. So as a federal mandate, the county would be required to be paying those things, would be required to pay those things. We recommend it to the extent permissible by law, payments made pursuant to our recommendation, this recommendations, be counted towards offset required payments, payments towards offsetting those required payments to the Families First Coronavirus Act. So to some extent, those expenses would have been incurred. To date, the county's taken strong measures in response to the COVID-19 pandemic, as you've heard. The CEO has fully activated the county's continuity of operations plans. Agencies have evaluated their operations and essential functions, and as a result of our public health officers' stay well at home order and Governor Newsom's emergency declarations, all employees who can are teleworking right now. Employees whose normal work duties have been curtailed have been asked to stay at home for now while we work hard to reassign them to critical duties that will arise inevitably as a result of this crisis. We anticipate that most of these duties will be in the healthcare agency, the human services agency, AAA, and other non-governmental entities or community-based organizations. Steps have already been taken to reassign. I think that this weekend we did reassign about 27 employees from other agency to those agencies that I mentioned, and many people within the healthcare agency have already been reassigned. However, we know that there's always a possibility that some employees will not be able to telework and will not be able to reassign them to other critical duties. And this recommended action is really intended to give those employees some relief over this anticipated extended period of time. So Section 1804 of the Personnel Rules and Regulations contemplate this very event in that it foresees that the Board of Supervisors, upon recommendation of the CEO, in the event of a natural disaster, which by definition in the personnel rules actually includes epidemics, they can step in and create a resolution to ensure that employees don't suffer a loss of pay during such time. Each employee, you should note, or I should note, each employee requesting this benefit will be required to complete an attestation. The attestation is quite detailed, is attached to the board letter, and it's going to affirm from the employee that their absence is directly due to the COVID crisis. The attestation form will be reviewed by the CEO's designee, typically a supervising manager, and then that approval will go into effect. Ongoing, of course, we continue to keep you apprised and the community apprised of our actions, and we'll keep you apprised of how many are being impacted by continued absences. But we're hopeful that many of our employees will not actually need to take advantage of this because we'll be reassigning them to other duties. So I thank you in advance for your support during this time and for the CEO Powers and Mr. Pettit's direction through this period. So thank you, and I'm prepared to take any questions that you may have.
Thank you, Mr. Powers.
Thank you, Chair Long and Sean. Just a couple supplemental comments. So, as we're reassigning some of these folks, it will be to essential services for the county, or as was mentioned earlier, community-based organizations in the community. And so it's really to keep our workforce strong during this very challenging time as we navigate these uncharted waters. As Sean mentioned, the HR department and the departments already this weekend already started this reassignment process. So it's getting folks to AAA and Human Services Agency to help with seniors, which is what we know your board would want us to do. So, and appreciate the spirit of all hands on deck that our county employees have who are so mission driven. Thank you.
Thank you, and I appreciate you bringing this forward as quickly as possible. And I do agree, we need to make sure the budget is there, the funding appropriately, just to make sure we have to be fiscally well. So I appreciate that very much. Supervisors, do you have any questions?
Yeah, Madam Chair.
Supervisor Zaragoza.
I support this item, and I think it's important that we protect our employees. And I just want to thank again our CEO's office and Sean Otten for putting this item together, that 1804, to protect our employees. So I do support this item.
Thank you very much. Any other supervisors? With that, if I can get a motion to approve.
So moved.
It's been motion to approve. Can I get a second?
Second, Huber.
Thank you, Supervisor Huber, seconded. Any further discussions? All in favor say aye. Aye.
Aye.
Any noes? Abstentions? Motion has been approved unanimously. If you need to bring anything further, please do.
Thank you.
Thank you very much. That moves us on from the regular agenda. We are going into closed session on the emergency agenda after the special meeting. Yes, Supervisor, Mr. Powers. Meeting? Yes, Supervisor, Mr. Powers. I know. Come on. I know how to run these meetings. Okay, so we will be moving on to the special meeting associated that was at the time certain 10:30, but I think we all agree that this could wait. So now, moving it to the special meeting, we have the County Executive's Office for the authorization of the CEO to approve and execute contracts and amendments to existing contracts as necessary. And then there's a whole bunch of stuff. Does that have to be read into? Okay, great. Then I'll pass it over to Mr. Powers.
Thank you, Chair Long. And as you can see, what this item is intended to do is to further enable your county departments to move swiftly. This is a fast-moving pandemic and crisis that we need to respond to. We've already been able to do that with the flexibility you gave us a few weeks ago. That enabled us to get those motels so quickly to help with the homeless issues. And this kind of additional flexibility in terms of purchasing and leasing will help us respond to the need for personal protective equipment, additional beds at the hospital, additional food for seniors, and just, again, really help us move swiftly and nimbly during this time of crisis. Happy to answer any questions.
Supervisors, do you have any questions on this item?
I do have one.
Yes, Supervisor Bennett.
What kind of safeguards are we putting in place to be sure we're maximizing our capture of state and federal funding for these activities? I know it's important to us. I know it's, it's from the CEO's office, the auditor, and everybody else. I want to make sure that none of the departments sort of say, oh, they don't know or it's inconvenient or whatever. I want to make sure we're capturing all those fundings, like for the homeless, for the motels, all of that kind of stuff. Could you help me with that, please? I'm certainly supportive of this. I'm certainly supportive of this action.
Excellent. Yes, thank you so much for asking that, Supervisor Bennett. We will, I can assure you, our office, working with the departments and the EOC over at OES, make sure that we maximize federal reimbursement. Just about every item that we are talking about here, I take that back, every item that we've talked about here, we are running that through the EOC to try to maximize our federal FEMA reimbursement, and that will be increased actually with the new major disaster declaration. And there's sort of 3 bits of advice that we've received on this, which is to document. And I can tell you our office came in and the budget analysts are working closely with the auditor's office and OES, EOC. They have a lot of experience doing this, fortunately and unfortunately, given all the disasters they've been through. But it is something, yes, we are going to draw down all of the federal dollars that this community is entitled to.
How about the state dollars that are the state dollars that have been allocated for homeless, et cetera? Is that a different? Besides FEMA, do we have to go someplace else to draw those down?
So there are additional dollars, that's right, that have already come down or been approved by the state for homeless services. It's about 100 million state. I think for us it's about 650,000, give or take. So we're going to draw down that resource, and we'll draw down FEMA resources, or try to, for things that they don't cover. But yeah, we're going to try to maximize all resources. Absolutely.
Right, and I will. Go ahead.
I'm sorry.
No.
And just as the item also mentions in your board, it was our office will also provide regular reports back to your board on the actions and the purchasing actions that we take.
And I also want to state, just to affirm for our Board of Supervisors, appreciate the CEO's office being on the NACO calls and CSAC calls with the intergovernment and federal calls. They're talking about just reporting, making sure you get all those numbers, going through the purchasing information for the state and federal. So I just want to say thank you. I'm hearing from the different counties that have never gone through this process. They are just learning about how to capture the numbers. And so I really believe that we're ahead of the game, unfortunately, because we've had those disasters in the past to really make sure we're capturing the funding. So I really appreciate everyone's efforts on this, because I think we're ahead of the game on that part.
I would also add that we do expect the majority of these costs to be reimbursed, but there typically is a local share of costs, as you know. I would also mention that we are recommending the money be moved over from the assigned reserve account program mitigation. That's, as I say, it's an assigned reserve. We are not touching your board's rainy day fund, just to be clear. Thank you.
Thank you for the clarity. Are there any other further questions?
I have one.
Yes, Supervisor Parks.
Thank you. As we are using these funds to contract, among other things, for services, is there language in these contracts that the contractor understands the perils of the position that they're taking? I think of the potential of liability. You know, if someone does contract the virus, that they are, that they wouldn't turn and sue the county.
County Council, do you want to answer that question?
Well, the only specific contract that I can refer to at this point are the 2 contracts concerning the motel leases. And expressly says in there that the use that to which the county will put the motel is to house people who either have COVID-19 or at risk of receiving COVID-19, or other persons that the county elects to put there. So those hotel owners are well aware of it. With respect to any other contracts, it would certainly depend on the nature of the service that's being acquired. If it will relate to potential interactions with folks who are exposed or at risk, high risk of exposure, then that is something we would put in there so that the contractor is aware of that and therefore assumes any risk related to that.
Thank you. I think it's important where we can to get that indemnification, even if the motels may know and have that understanding, and having them also agree that they're taking this responsibility on their own and that they won't turn around and try to sue the county. So I'm glad we're looking into that. Thank you, Michael.
All right, Mr. Powers, did you have anything?
Yes, I would like to ask our auditor, if I may. I think there's an adjustment we need to make on one of the recommendations.
Oh, thank you.
Thank you.
Yes.
Yeah,
Mr.
thanks.
Berg.
Thank you, Mike. Yeah, on recommendation 6, we call out the first increase in unit 2506. We have fixed assets there. We'd like it to read 2506 equipment. So
Thank
that's
you.
the change. Thank you.
Thank you for catching that. I appreciate it. Is there any modifications or any other changes? Supervisors, do you have any comments or questions? In saying that, hearing none, if I could get a motion to approve with amendments. Oh, Supervisor Parks, do you have another question?
Motion to approve with amendments.
Thank you so much. If I have a first, can I get a second?
Huber, second.
Okay, Supervisor Huber is second. Any further discussion? All in favor say aye. Aye.
Aye.
Any noes or abstentions? Motion has been approved unanimously. Thank you so much for everyone's input. I know it is almost 12, and we will be moving in now. That ends our special meeting, and we'll be moving into our emergency meeting, and we'll be moving into our emergency meeting for our closed session. There will be nothing to report out on that, and we will be giving you notice online as to when our next board meeting is, hopefully next week,
Yeah.
if we can. So,
Chair Long,
Mr. Powers.
thank you so much, Chair Long, board members. Before we convene into the closed session, I did want to make one announcement here, so I think this meeting, in my humble opinion, went very smoothly, covered a lot of ground, but there's a lot that it took to make it so. And so I really want to call out the people who helped make that happen. When things are smooth, you don't hear about it because they do such a good job, right? But that's obviously starts with Rosa Gonzalez, Brendan Blahakas, Lori Key, Wayne Kirkland, Ethan Edmonds, up there in the booth, John Lynn, and Steve Long. I've actually had several of the cities contact say, how are you able to do that so smoothly? Well, all of those names I just mentioned, that's how we're able to do it so smoothly. So thank you to the team.
Thank you very much. And also, Supervisor Parks, go ahead.
You're here. They have done an amazing job.
Great. And for the public to know, we know that there's many counties that are having press releases and so forth. And this meeting here, we feel it really gives us the spatial distance and providing more in-depth information on a weekly basis besides our daily information that we're pushing out. So I hope this is answering the questions to everyone, and really appreciate the feedback. So thank you so much for everyone for the hard work. Thank you.